All right, good. So, and then you can enlarge it to post. Beautiful, great, excellent. All right, great. So stop share now, thank you. And then we're gonna start admitting everybody. It's now 5 minutes to 7. I'm gonna start admitting people. Here's Whitney. Whitney, are you here? Whitney? active. We are gonna give everyone about 5 minutes. We're gonna start in about 5 minutes. Allow folk who we had some technical challenges initially in terms of joining the meeting. So I think that's behind us. We're gonna allow about 5 minutes before we get started. So we'll just get started about 5 minutes after the hour. So welcome again, and I'll come back and speak more.
Yeah, I'm unmuted, so.
Hello, good afternoon, good evening, everyone. Welcome back to our early home-based COVID treatment conferences. It's been a little while, but it's good to be back. It's good to be here. And for all those who are attending for the first time, we assure you this will be a very empowering conference to you. as it has touched so many people in the past. Tonight, we have an excellent lineup of speakers as well as testimonials. And we are very grateful to what's happening in our land at this moment as our COVID pressures are declining. And we are very grateful for whatever, all the different forces, the power of God that's contributed to this turnaround in our numbers at this moment. As we embark on this early home-based COVID treatment conferences, we are waiting a few important presenters to join, but of course, we don't want to delay too much. We have deliberately started a little behind time to allow as many people to get on a platform. There were little technical glitches initially, but I think we're over those by now. We have great presenters. Of course, we'll start off with Pastor Mary Wildish, leader of the Trumpet Call Ministries International, and she is going to give us a moving spiritual journey tonight, as well as giving us her own experiences thus far. We are very grateful for all those who have been able to attend near and far. We know that we have representatives from the Caribbean, as well as from North America here, as well as hopefully also from Europe, particularly the UK. We are very happy to see and have everyone here tonight. And we are very confident that we will all leave empowered tonight. So without further ado, I'd like to hand over to Pastor Mary Wildish as she leads us in our spiritual journey, as she leads us forward through these troubled times. Pastor Mary Wildish, welcome back. Lovely to see you.
Thank you so much, Dr. Hunter. It truly is an honor and a privilege to be here with you and support all that you are doing to educate not just this nation, but nations on early home-based treatment for COVID. I'm going to pray tonight and then share a testimony of what we're doing and encourage the people of God. But let me open in prayer. Father, I want to thank you that you are the Alpha and Omega. You're the beginning and the ending. Lord, that you are our healer, our rock, our fortress, and our strength. Father, that nothing is impossible with you. Father, I thank you that you give solutions for problems. Father, you give wisdom when we cry out to you, oh God. And Father, tonight I ask you to watch over each presenter and to be with those that will be watching this, seeking for answers to get well. And Lord, we commit this time and this program into your hands in Jesus' name. Amen.
Amen.
Amen. I just want to take 5 minutes and just to share personally with those of you that will be watching, to encourage you that if you get a cold and if it's COVID, it is not really to panic. I want to encourage you that there's global panic, that I actually know of people that the minute they got diagnosed with COVID, they fainted or they had such an anxiety attack because they thought it was a death sentence. COVID is not a death sentence. I'm a pastor of a decent sized church in Montego Bay. We have hundreds of people that call themselves members of this church, and I have the opportunity of serving them. We have had in 2021 over 65 people in this church that have contracted COVID and got a COVID positive diagnosis. Not one of those people has died. Thanks to the Lord and thanks to what Dr. Hunter has taught us. So one of the recent testimonies that we have is a young girl, 45 years old, 3 comorbidities, high blood pressure, obesity, and severe asthma, contracted COVID, got a COVID positive test. Her whole household was positive with COVID. What we have done here at the church is that we have embrace the protocols that Dr. Hunter and other medical people have taught on this platform. We have acquired the medication, and the minute someone exhibits flu-like symptoms, even immediately after they get their COVID test, we begin to administer these protocols. And so Even this week, earlier this week, we have 4 people positive with COVID. They took the test and they started the protocols even before the PCR results came back. And we are finding that foundational cocktail that will be presented here, along with prayer, along with faith, along with trusting God, that people are getting well. And so I'm here to let you know that over 65 people, not one person has died from COVID. We had 1 hospitalization and that person pulled through. I myself am sitting in front of you today. I'm a COVID survivor. I had COVID last year in 2020. I had a very bad case of COVID before we knew of all these protocols. But I used wisdom, foundational medical strategies like what Dr. Hunter is saying, and with the help of God, I pull through. And so I want to say that if you're watching today, if you're a pastor, if you're a leader, if you're in the private sector, if you have influence over people, even here in Jamaica, only 12% of our population is vaccinated. That leaves 82% of our population needing a treatment now, not able to wait to be vaccinated. And so early home-based treatment for COVID works. And so Dr. Hunter, myself and my congregation would like to thank you. And I know that many people will watch this broadcast to listen to the medications that you recommend, the strategies that you recommend to treat COVID early. And again, I say to you that are watching, we treat PCR test treatment even before the results come in. And to God be all the glory, it is working. So Dr. Hunter, may God continue to bless you and the other doctors that are on here, and may lives be saved.
Amazing, Pastor Mary. Thank you so much. You know, when I listen to you, I'm so inspired. It's so powerful. It's moving to hear the amazing, the touching results that you're getting amongst your congregation, to know that you're still together as a body. And we would like to learn, to hear from these, so see how we can replicate this, these results right across the board through experience sharing. You know, I just got some very, very sad news that a colleague of mine, we're in medical school, graduated over 25 years from the UWI Medical School. He's in Belize and he's now battling for his life. You know, he has, of course, been treating a lot of COVID, and he's battling for his life. And we saw some statistics today where 4 people died unvaccinated and 2 died who are fully vaccinated. We welcome the vaccinations, but we know vaccines alone will leave us short. Vaccines are not enough. So we really want to emphasize early treatment, not to wait on the COVID test, but as you have done, whilst you wait on the PCR test, to start treating early, to tell, to share our burdens, to tell about it. Isn't it so, Pastor Mary?
It really is so, Dr. Hunter. And you know what we've done, and I've shared it with you personally as a church, is that we have just determined to give this medication to all of our, to acquire the medication, to partner with doctors here in Montego Bay and to pharmacists here in Montego Bay to acquire the medication, to help people that don't have the finances to get these medications. And the medications are not particularly expensive medications. We know that I don't want to share the protocol because I'm not a doctor, and that's what the medical faculty will be on here. But yes, I mean, Dr. Hunter, for example, this week we got 4 positives with COVID, and we partnered with the pharmacists, with medical counsel. Some of these people do have comorbidities. The first thing is to deal with the comorbidities. If it's high blood pressure, diabetes, you get everything stable. You make sure that they get on their meds, their blood pressure comes under control. We treat with ivermectin, 12 milligrams of ivermectin, or according to the weight, for 5 days, along with high doses of vitamin C, vitamin D, zinc, and that is our foundational treatment. We add to that, for example, one of the people today, we steam, the whole aspect of steaming. They give me my Dr. Hunter, you're going to laugh. My congregation call me morning and evening and give me a medical report. And I get a voice note from them. Pastor Mary, I steam 4 times a day, 6 times a day. I coughed up mucus. Azithromycin is added as necessary. Dextromethasone is added as necessary. Aspirin is added as necessary. Ventolin and another purple inhaler is a steroid inhaler is added as necessary. Nebules are added as necessary. So I get reports this evening. I will get reports on how much phlegm they coughed up from the steaming, and none of them, these last 4 cases, and this has been the testimony, none of their oxygen levels have dropped below 98. So they're stuffy, they have flu-like symptoms, we're treating early, and this is an honest testimony. Over 65 people, 1 hospitalization, and people with multiple comorbidities are experiencing flu-like symptoms, discomfort, aches and pains as they walk through this 2-week treatment. And, I really cannot emphasize, Dr. Hunter, we all know that the vaccines, you can still contract COVID after being vaccinated. And we are now learning that the vaccines have waning efficacy. And so some of the vaccines, after a number of months, they only produce 60% or 70% efficacy based on the individuals. And so this information is not just for the unvaccinated, it is also for the vaccinated. And I am, behind you, along with our congregation, 100%. I believe we need doctors that are willing to treat this virus. And I can testify to you that, I'm on a exercise program. I've lost a lot of weight due to having COVID, building up my immune system, getting sunshine, trying to get the rest I need. That's not always possible, but I do my best. But Dr. Hunter, I truly believe, we know that there will be variants that come out. We know that the Delta variant is not the last variant. And as these variants come out, they're not going to be able to give booster shots in time to reach the people that the virus is spreading to. And so we need early home-based treatment.
Absolutely. I mean, I just got some sad news again last week. There's a dear friend of mine by Jim McEwen, who lives in Hanover, fully vaccinated, and sadly with 3 negative COVID tests, flying back to Jamaica from the United Kingdom, originally from Ireland. And he died from COVID, fully vaccinated. He waited about a week before he gave in and decided to go get treatment. It's such an important message what you're telling us. This is not just for the vaccinated. This is not for the unvaccinated. It's for everybody, the vaccinated and the unvaccinated. The variants are going at breakneck speed, and a negative test can be falsely reassuring. What say you?
No, actually, Dr. Hunter, thank you for the opportunity. A negative test can be a false reassurance. And I will give you a case classic that we had about, I would say, months ago. We had our senior worship leader. She did not feel well. Her sister that lives in the house was diagnosed with COVID. She began to exhibit some flu-like symptoms, and she took a test. When she took the test came back as negative. We decided to go ahead and treat her anyways. And so she got a negative test, but we treated her with the full-blown protocols for COVID. She got on the treatment. 4 days later, we tested her again, and she was positive. Had she not got on that treatment early, Dr. Hunter, she was the one with asthma, high blood pressure, and and obese. And so once again, I cannot advocate strong enough early treatment at the onset of the first symptom.
Thank you so much. May God forever bless everything you do, your ministry, your daily life, everything be a success for you. But we know that faith alone is not what you do work as well, and you save so many lives through the work that you're doing. Thank you so much for blessing us tonight and for sharing your experiences.
Thank you, Dr. Hunter. Thank you.
Thank you. Okay, as we move on, we'd like to welcome our first medical presenter for the night, and we'll have a person who is going to inspire you. He very credible, an excellent dentist, one of the first graduates of the dental school at University of Technology, which you know has impacted Jamaica and the Caribbean and the world since it started, I think, over 10 years ago. This University of Technology Dental School has done amazing things. And we have Dr. Seymour Esor, who will enlighten us this evening, who will present to us this evening and will tell us, not just from a theoretical and an abstract perspective, but also from his own experiential perspective on COVID. So Dr. Esor, over to you, sir. Welcome. Welcome to our meeting, and over to you.
Good night. And as you said, I'm a dental surgeon, graduated from UTech. Been practicing now since graduation, graduated in 2015. I operate 2 offices, one in Kingston and another in Savlamar. Do a lot of traveling. Travel to Savlamar on the weekends, and in Kingston during the week. Dentistry and your health. Very important because the COVID virus is usually contracted from the upper respiratory tract, that is through the nose and the mouth. So dentistry has a lot to do with the mouth. With this presentation, I'm just going to go through some of the interesting things about dentistry, some basic things that other persons might not be fully aware of. And then I'm going to dive into a lot more about how this concerns us pertaining to COVID. And then I'm going to finalize the presentation with any questions that you may have. And you'll also have my information at the end if you have any additional questions after. So, dentistry. What is dentistry? It's the prevention of diseases in the oral cavity, also the treatment. Anything that has to do with the teeth and gums, a dentist uses that in terms of fixing that. It's the removal, correction, and replacement of decayed, damaged, or lost structures. So filling, among other things. This is just a very basic diagram showing you the oral cavity. We can see all the way back. We have the tonsils, the tongue, and the teeth. It's so funny that COVID really is presented to the back of the throat, the area where the oral cavity connects to the nasal chamber in the back, and that's where it lies. So the sneezing and the coughing brings the COVID from that area and the lungs out into the atmosphere on vapor, or should I say droplets. Okay, so oral health and general health. A lot of persons don't realize that the oral cavity has a very diverse ecosystem of microbes, viruses, bacteria, fungus, all of them, they're in the oral cavity. And issues with the oral cavity can have overall issues in other areas of the body. For instance, issues with the jaw joint when you can open your mouth and close it. You may develop migraines if there are malformations or developmental problems with that joint. The way how your teeth come together may have you having issues with snoring. Cavities, everybody knows what cavities are, but they house a tremendous amount of bacteria that then travels throughout the body and cause problems. Also, gum disease does a similar thing. Mostly a different type, but they're all bacteria that when you have gum disease or cavities, it's overpopulated and they fight out or displace other bacteria. So this chart, I got it from the website, from the Mayo Clinic website. And right now, there are no, should I say, hard evidence to prove that the oral cavity has an effect on some of these. However, as you can see here, gum disease increases the risk of head and neck cancer. And gum disease is just bleeding gums, you brush it and it bleeds, puffy gums, stuff like that. Tooth loss and gum disease increases the risk of Alzheimer's disease. So you have a lot more information here. Pancreatic and kidney cancer increases that risk. Diabetes, rheumatoid arthritis, heart disease, premature birth, a lot of other things. And these are studies that were done on individuals who had these issues and were found to have poor oral health. Oral cancer. Yes, oral cancer is one of those cancers that once identified, certain oral cancers, you have 5 years of life left usually. Some of these, most of these actually. You have certain risk factors, smoking, drinking, the HPV virus, human papilloma virus is the one that is very dangerous as it pertains to oral cancer. You have some percentages there. It's safe to say that the percentage of persons having oral cancer worldwide is increasing every year. I'm just going to skip through really fast because I want to get to the part that has to deal with COVID and the oral cavity. So this picture just shows you a tooth, a healthy tooth to the left, and as it progresses, you can see that the tooth develops a cavity. All teeth have cracks in them. Some of these cracks, they develop, the teeth, they develop as, I would say, roots of a tree growing. And as you get older, it's in your mother's stomach, these trees fuse together, and this fusion here leaves cracks. Those cracks harbor bacteria, none of which you can get rid of using the toothbrush. It is imperative that you go to your dentist to find and check up on these every 6 months. If you ever have or look at the side of your teeth and you see these areas that are chipped out, you can put your fingernail there or something there and you can feel an area that's missing. Most times it's not a cavity. It's due to the fact that your teeth are not aligned properly and you're biting incorrectly on them, causing them to bend. Yes, your teeth can bend and eventually break apart at the sides. And that's what we're looking at here in this picture. Usually what you need here is a night guard. We always have a lot of kids having accidents. So as dentists, we have to deal with this. You know, if a child hits his tooth in an accident, tooth comes out. Usually once you put the tooth in some milk or in the child's saliva, get it to the dentist within half an hour, the tooth has a strong chance of surviving once you do that and we put it back in. So the tooth can come out and it can go back in and still survive. Very interesting. There are different causes of halitosis, or persons that have bad breath. A lot of different causes. Sinus infections, not brushing properly, not having enough saliva, whether it be medication driven or not drinking enough water, that can cause it. Respiratory infections, lung disease, smoking, acid reflux, and others. So when you get a cavity, you can either fill the tooth, or if it is too far gone, all the way into the nerve, you can do a root canal on the tooth to save it. And once you cannot save it, and in the past, I used to like to take out these teeth really, because it was probably most economic at the time, and also the dangers of removing your teeth weren't really known. So to replace these teeth, you have quite a few different options. You have implants, bridges, dentures. And in our office, we do a lot of cosmetic dentistry. So we do whitening, and we also do veneers. Fluoride treatment. This helps to stabilize the bacteria that loves to eat your teeth. And usually once it is that somebody develops cavities really easy and we can identify that that's the case, we will apply fluoride to the tooth every couple months to ensure that the cavity doesn't progress. There are some pictures showing you some issues when you remove your teeth. The top one on the left here is showing you that the lower teeth move up into the space that the top teeth were. And now there's an issue because now these lower teeth cannot move back down naturally. So you either would have to trim those, or you'd have to remove them in order to get this, or get the person to chew properly again. This picture on the upper left-hand side showing you dental implants where you're putting back the teeth, but it is something stable, it doesn't come out. And it's a viable option for persons needing replacement. We also do wisdom teeth extraction and so on. I'm going to skip through a bit here. Let's get to the important part for tonight. The oral cavity and the microorganisms that live in it. So I was saying to you before that it's the second largest ecosystem of microbes within the body. The gut or the stomach is the largest ecosystem of bacteria, viruses, fungi, and so forth. There are over 700 species of these microbes living in our oral cavity. And they live there, but they form within that environment certain rules for each other. For instance, they don't allow the other one naturally to grow too much, because in essence, if that happens, these microbes, most of them are very dangerous. So if they overgrow to an extent, you'll have, for instance, pneumonia or other issues. You'll have quite a bit of other issues. So when you have something like COVID, and COVID disrupts the oral flora, we call it, the ecosystem, as a result of you taking maybe antibiotics that are too specific, or in general, the virus itself causes inflammatory mediators and cytokines to cause an inflammatory reaction, changing that ecosystem. And once you change that ecosystem, you have certain opportunistic pathogens, the ones that cause pneumonia, because viruses that cause pneumonia are present within the oral cavity. It is there naturally, but because, as I said before, they are controlled by the other viruses and bacteria and so on. They don't get to grow to an extent where they can be dangerous, but COVID allows them to flourish. And then once it starts from the oral cavity, it moves to the lungs, where then you know what happens from then on. So it's very important that for the oral cavity, a great part of early treatment would be, yes, you have to cleanse more often the oral cavity with certain things which I'm going to speak to you about more often than you usually do just morning and night. Just brushing and flossing is not going to really help. You have to really use, whether it is peroxide, chlorhexidine, but more so an antiseptic that is geared towards getting rid of the COVID and destroying it. So povidone iodine is one of those antiseptics, and you can use that for 2 minutes, the 1% oral antiseptic, and it gets rid of the COVID or the bacterial load, viral load also, without harming the ecosystem of that oral cavity. So it is very important that not just brushing, but gargling with this, because as I said before, the COVID is really in the back of the throat, behind the nose, that area. So you have to gargle and then you have to swallow. So you get some of it along that gastrointestinal area. So some of the issues that we see developing as a result of opportunistic bacteria and viruses taking over when you have an infection or when you have something like COVID entering your system, it is almost like a cascading and a reverse effect. So all those who had COVID, some of them experienced some of these issues, which then worsened the COVID. So decreased salivary secretion increases the bacteria that's in the mouth and the oral cavity. It also decrease the immune factors, which are, fighting chemicals that help to ward off certain viruses and bacteria. Malnutrition is one of those next things that when you have COVID, you don't feel like you want to eat anything when it reaches a certain stage. So all that malnutrition increases the immune factors also. Decrease in physical activity, poor oral hygiene, as I was said before, not cleaning enough. Abuse of antibiotics is the next one. So if it is that you're using an antibiotic that is going to get rid of some of the bacteria and not all, which you really can get rid of all of them, the ones that remain will have an opportunity to then start to overgrow and take over your system. And usually with COVID and the antibiotics that are given, you have issues with resistance afterwards, because you have to give so much antibiotics. You may have an issue if you are to take that same antibiotic again, it might not work. So to decrease the immune function causes the bacteria that are opportunistic respiratory pathogens like pneumonia and so on to really flourish. And this is pretty much the key to early treatment. And you really need to understand that the oral cavity is a lot more important than you think it is. So I would say all of Dr. Hunter's guidelines, a lot of persons may think that maybe he's thinking that maybe, the oral cavity is a little bit, you're thinking about it too much, but it enters from the oral cavity and the upper respiratory tract. As a dentist, I wore my mask since 2019. I have a special mask that I was wearing. It's an ultraviolet mask that, my opinion, helped me from 2019 until I caught COVID. So I caught COVID in September, actually, of this year, the first week in September. And I was hesitant about getting the vaccine until September. I went to get the vaccine, and It was a very crowded place. I stood there for 3 hours to get the vaccine. And I tested before going to get the vaccine just to make sure I wasn't positive. And 4 days after getting the vaccine, I couldn't breathe. And then I did a test, found out I was positive, and it was downhill from there for me. Um, a lot of dangerous things happened. Some of those things I never knew could happen to me because I consider myself a very strong person. Got in contact with Dr. Hunter, and he helped me to get over COVID. I'm very thankful for that because I'm sure if I was stubborn and continued, it would have gotten a lot worse. I don't think I would have survived, to tell you the truth, because as he was saying, the cytokines and the inflammatory mediators were given to you with the COVID vaccine, or your body, it pretty much speeds up the process for COVID to take over. So it is quite, it's almost 100% more in terms of what you would feel if it is that you weren't positive with COVID when you took the vaccine. So I'm very thankful. And as I said before, the oral cavity is very important. Once you have gum disease has a lot of these pathogens that are there. And you need to do your cleaning. You go to your dentist to do your cleaning. Get rid of all of that excess buildup of bacteria and get the mouth really healthy, because once the mouth is healthy, your body will be healthy. I realized that using even Listerine, while I had COVID, using Listerine and gargling with Listerine, and swishing around with it after I brush my teeth, the coughing tend to subside for a short period. Maybe it was half an hour, I don't remember, but around half an hour it subsides. So it's very important that that you understand that it gets rid of the bacterial and viral load for a period. And if that's all it took, I was very okay with doing it, because half an hour felt like about 5 hours in terms of the pleasure I felt without coughing and all that blood that was coming up and so on. So I thank you for your time. I'm going to skip through a couple slides here. This is just talking about the treatments and the different things that we do at our office. We're a full service dental office. The only thing we don't do is braces. We have state-of-the-art equipment, first world kind of stuff. We're one of the only offices in the Caribbean that is so like a one-stop kind of an office. We have the laboratory at the location. We make everything for you, and if you don't like it, we redo it for you free of cost. So that's my those are the different locations. That's my contact information. You have my emails there, and also our website. We're on Facebook and Instagram also. If you have any questions, I would love for you to ask them right now. As I know, Dr. Hunter might be saying that I went over my time, but it was nice speaking to you guys.
Thank you, Seymour. It's, as always a pleasure sharing and speaking with you. Can you stop sharing your screen so that I can just have a brief discussion with you?
Yeah.
Your presentation is so powerful and so meaningful for so many reasons. But at the end, it was very clear that you contracted COVID, and the context in which you contracted COVID is important. It's something that we have touched on earlier in our earlier conferences. But to be in a vaccination line with 400 people to 100 vaccines, that was always going to be a little bit of a problem. You want to just say a little bit more about that and the logistics and how we could proportion and to actually end up with a situation where we actually have COVID and the vaccine on board at the same time?
Well, I think we all know that the size of COVID, the COVID virus that travels on the droplets, it's small enough to pass through your surgical mask, which that's what everybody is wearing. And even if you're 6 feet apart, I mean, I'm not gonna discriminate or anything, but I think that even if you come into my office and I'm in the next room, and you come in and you're like, I have my mouth has a smell, and I could stay in the next room and smell it. Those, that scent is traveling to my nose with microbes on it. That's what you need to understand. So the mask, it takes the bulk of those microbes away. But even if you're 6 feet apart and you have 400 people standing together and you have a fan blowing all that air, quite a few persons are going to catch COVID. I don't believe that the magnitude of something like that is not, it's not pretty much, they're not shedding too much light on it, that people should not be in crowded areas. They should just, I mean, if you're going to get the vaccine, you shouldn't get COVID while you're trying to get the vaccine. That's what I'm trying to say. And it was very evident that that's when I got it.
Yeah, that's a very important point, because the WHO, in addition to the manufacturers of the vaccine, say that you must not take the vaccine whilst you have COVID. So it's a problem that people have to contend with. Here it is that in the process of getting the vaccine, you can contract COVID, especially when we had a 50% positivity, because your experience is about 2 months ago, if I'm not mistaken. I think at that time
it was in September.
very high. Yeah. Yeah. So, I mean, and you normally don't get sick. So for you to get sick, it meant that you really got a significant hit. Your system is normally quite resistant to illness, isn't that?
Yes, of course it is. Of course it is. I think dentists on a whole, because we were using surgical masks before COVID. So
Yeah.
a lot of stuff used to pass through that mask, and we developed, our immune system got really strong as a result of that.
Right. But I think steaming, in your particular instance, when we added steaming to your regime, that really seemed to have done the trick as well, in addition to the ivermectin and the IV antibiotics and the IV.
Yeah, the remdesivir and all of those things. Once I got those, it was pretty evident that I probably should have been doing that from the first sign of, from the first symptom. But I did not know, to tell you the truth, that it was COVID, because I thought it was as a result of the vaccine. So here you have a situation where you have to be careful, because persons who take the vaccine must also understand that once they start to develop certain symptoms, they should really get a test. As simple as that. Because if you're gonna treat them early, you probably need them to know that they're positive. Because if they're gonna sit there for a whole week and then get bad, it's dangerous.
Because we have also emphasized this, and we touched briefly earlier on, that we can get falsely reassured by the test, that we can't only go by the test, because the test could easily be negative, but then you're positive. But to have a pulse oximeter showing that you actually have an oxygen saturation that's below 95%, that would be enough to trigger you into starting to steam, to hydrate, to oral hygiene. Very important, isn't it? What do you say?
Yes, of course. I mean, the fourth day when I started to have that short of breath, it was pretty evident that I was not getting enough oxygen. I could only barely sip air. So at that point, yes, if I had my oximeter, I would probably see that it would have been below that 90. But I just thought it was symptoms from the vaccine,
And what made it particularly more concerning for you is that your wife recently had a child, and she was within the period.
Yes, I mean, I got the vaccine. Yes, you're supposed to isolate a medical personnel, but I was sleeping right beside her. She was pregnant, I was, and when I coughed the first time, she got up to switch rooms. She was like, "You're on your own."
No, in a loving way. She,
yes, of course, but
yes, I don't want anything to happen. Pregnant women have had a very high price to pay with COVID, and that's why it's also recommended, not mandated, but recommended, that pregnant women also take the vaccine, because they really don't, a lot do die when they get COVID in pregnancies, a very serious toll. But you did everything, but it's really important to treat early, and I'm just grateful that you're here today to empower, to share with other people. So they know, for instance, steaming, treat early, suspicion, don't put it off, don't delay, for God's sakes, do not delay. Start something early. Get in touch with a COVID-enabled person. Doesn't have to necessarily be only a doctor. A lot of people now have COVID information, good advice that could save your life. So, I'm very grateful for your presentation today. I'm going to ask you to stick around a little longer. We're gonna move on to the physiotherapist because we usually take Q&As from the audience at the end. So I'm gonna allow Mr. Andre Duncan, a presenter, a physiotherapist, to also join us because he's seen the work that we've been doing with the cupping, and he certainly is an expert in physiotherapy and all things physiotherapy. So I think we would greatly benefit from Andre's presentation. So again, thanks, Brother Seymour. Thanks, Dr. Isor. Thank you so much. Over to you, Mr. Duncan. Welcome, and over to you, sir.
Hi, good afternoon. I mean, good evening, everyone. Let me see. Okay.
Good evening, sir.
Good evening, everyone. All right, so it's a pleasure to be here. I must, thank Dr. Hunter for inviting me once more. Okay, it seems as if I'm having problems already. Wow, hold on.
So,
I'm having problems accessing my.
Oh, there you go.
Okay. No.
Share screen.
Okay, there we go.
Lovely.
Can you see? Can you see my presentation?
No, we're seeing you. Are you on shared screen? You click share screen.
Yeah, I did. Oh, here we go. There we go. Perfect.
There you go.
There we go.
Good.
All right, yeah. So I just want to tell you guys, thanks for having me once more. My presentation today, so I've been working with Dr. Hunter for a while, and we have a lot of discussion in terms of management of COVID patients, early management. And, there's a lot of truth in it. I mean, being proactive is definitely the way to go in life. Anything you do, being proactive is definitely the way. All right. So here we go. So in this presentation, I'll be talking about a little bit about cardiopulmonary physical therapy, diet, home exercise program, which is very important, equipment needed at home. So even start with the very beginning, right, of management of COVID is very, very important. We're going to go into prophylactic physical therapy care for the positive COVID patients, as well as COVID pneumonia and long COVID rehabilitation, which a lot of people have been having problems even after recovering from COVID. Now, hold on, I can't see my screen properly. Hold me a minute. All right, there we go. Right. Now, what is cardiopulmonary physical therapy? Now, first thing, physical therapy is a very wide, very vast profession. It's very wide. We have a lot to offer the world, right? And cardiopulmonary physical therapy is an area of physical therapy that is specialized in the prevention, rehabilitation, and compensation of clients with disease and injuries in the heart and lung. And these are examples of conditions in which we treat in cardiopulmonary physical therapy. You have asthma, bronchitis, bronchiectasis, emphysema, and the list could go on, right? And COVID would be the newest one to this list. Now, okay, I can't skip. Hold on. What do I skip? Oh, okay. Right. Now, what's one of the most important thing about battling COVID at this time is the diet. We have a very poor diet as a Caribbean country. Now, if you think about the 3 leading causes of death in the Caribbean, it's what? These are non-communicable diseases in the first place. So you have the diabetes, the hypertension, and the list can go on, right? So what we want to focus is on increase water intake by substituting water for juice, right? We want to reduce sugar intake, salt, fats, oils, and other carbohydrate, because all those break down and is stored as fat. We want to start increasing, our intake of vegetables and selective fruits and spices. As it relates to fruits, sugar is very high in ripe bananas, mangoes, so we need to limit how much we eat. For the past couple of years, for the past 10 years at least, we have, I mean, I haven't been a physical therapist for about 9, 10 years, and I've seen an increase in children that has diabetes, that is obese, that has hypertension, and the different cardiovascular diseases. And before this was unheard of, right? The paradigm has shifted, and therefore we need to also shift with it. A lot of persons tend to go to alcohol and smoking to reduce stress, but there's a lot more that we can do to reduce and to control our stress. Now, there is clear evidence that obesity is a risk factor for severe COVID disease and death. In 2001, May of 2001, the America study, the University of North Carolina published an article stating that having a BMI, body mass index of 30 and above is said to be obese. Therefore, increasing the risk of being admitted to hospital by 113%. And this same population has a 74% chance of actually being admitted to ICU. So this is how bad it is. And you have 48% actually, at risk of actually dying. Now, when compared to England actually have similar outlook as it relates to, or similar results on mortality rates as it relates to COVID-19, where there is a 90% increase in persons, death in persons with a BMI of 40 and above. Now, that is very interesting information right there. You know what I mean? So it is clearly evident that being obese is a clear red flag that, you can actually succumb to the injury if you were to contract COVID. Now, as a physical therapist, what do I push? What do I promote? Now, I promote living a healthy lifestyle, exercising properly, sleep, very important. Now we're going to go into some of the things that we normally do. So you have stretches, which is a part of your exercise. You can try yoga or Pilates. I mean, these things actually help you to relax the mind. So instead of turning towards alcohol and your late night eating and you smoking, you would start putting some of that work into exercise, with a strengthening exercise. Now, as we speak about strengthening exercise, you want to target muscles such as the core muscles, the abdominal muscles, because guess what? When you contract COVID, if you were to get really ill with COVID, one of the things that you definitely should have is a very strong and effective cough. And we often see persons who are very ill have a poor cough. And that in itself prevents the individual from having an effective clearance technique via coughing. Now, as a physiotherapist, I tend to do other things such as stimulating tracheal stimulation, which can be very painful. But if you can target the abdominal muscle to actually function the way it's supposed to function, then we're one step ahead. Now, cardio is very important. Another talk is very important. We can do cardio in several ways. There's no limitation as it relates to cardio, because even the man who can walk has a chance to do some cardio, whether it be swimming, walking, jogging, bike riding, etc. Now, if you look to the right, there's a lady with that's in a wheelchair who is obviously limited in terms of function as it relates to the fact that she doesn't have, her leg is there, but she's probably not strong enough. You have a arm ergometer. No, there are several ways. There's no limitation. The limitation is there, yes, but we can truly find different methods of achieving what we truly want to achieve. So as you can see, she has a arm ergometer that works, right? And you have different techniques. You have the pulley techniques that we can use. There's a vast majority of techniques that we can use. Now, when you speak about cardio exercises, you would like to do at least 30 minutes of moderate intensity exercises for 3 to 5 days for the week. Listen, I know we're tired, and after we left work and we go home, it's really hard to do anything. But let me tell you, it's okay if you just get up and say, you know what, today I'm going to go slow, and you're going to take a walk. Take a walk and just go a little bit harder. Deep breathing exercise with your walking. Those help. And I'm going to use a little example. So I'm growing up as an athlete. I play football, right? Now, when COVID hit the world, when the pandemic started, football and everything went downhill, right? Now, a few months after, you recognize that they start having the English Premier League. Now, a lot of those players actually got infected with COVID and had to be quarantined. But guess what? No one succumbed to it. Everybody was just up and about, 2 weeks up and about and going. Why is that? Obviously, it's because of the diet, the proper diet that they have, one, proper sleep, and also the exercises. Now, with the amount of exercise that they put in, their metabolism is 2 to 3 times a natural man. So if you look at that in itself, you will know that just by being physically active, you give yourself an edge over everybody else who decided that, I'm not going to work out. So it is very important that we maintain or understand this, because guess what? Natural medicine is the best form of medicine ever. Natural medicine is the best form of medicine. Remember, I say this. Moving on. Now, when you're at home, there are some of the things that you truly need. And these are a list of them, actually. As Dr. Hunter was saying earlier, your pulse oximeter. Your pulse oximeter is a must, especially in this time. I encourage every household to get a pulse oximeter, right? And if it's that you don't understand what the parameter is supposed to be, it's at your fingertips. You go in and you ask what your oxygen level is supposed to be like. Everything is right there at your fingertips. So you need a pulse oximeter, incentive spirometer, blood pressure machine, a steamer, a nebulizer. And I mean nebulizer for the purpose of persons who actually contract COVID tend to develop and tend to have a lot of thick mucus. And some of the mucus, no matter how much you've gone and you do percussion, everything, it doesn't move. So you would add now hypertonic saline to the nebulizer, which would then literally pull water from the body to soften the secretion. So therefore, when you cough, it can actually move along the respiratory tract. You'd also want a thermometer as well as GMR machine for persons who have a diabetes and and GMR strips. Very important. These are the basic things that you should have. Now, let's get into what prophylactic physical therapy is really. Now, as you know, I'm going to give you a little example. So I work with kids. So what happens is that you will have a patient that comes in with sickle cell, for example, and they have they need help right there and then. One of the things that we do before, in fact, if they have to do surgery at all, what they do, they send us to do prophylactic physical therapy so that we optimize the oxygen intake, right? So this is the same thing that we should put forward as it relates to COVID. Now, moderate intensity of cardiac exercise, very, very important, right? You want the breathing exercise as well. Now, SMI, which is sustained maximal inspiration, it's literally this, sustain. So you take a deep breath in and you hold it. Now, when you do that, what happens is that the airways of the lung open up. It opens up. As it opens up, air is allowed to go around wherever there is any blockage around. And you have something called collateral ventilation. So if it happens that persons have mucus, then the air can actually go behind the mucus. And once it goes behind the mucus, it's just a natural instinct for us to just cough, clearing the secretions, right? So I'm going to move to the other. They have like the PEEP, which is positive end expiratory pressure, which is also it's literally like blowing. What happens is that when you blow, right, you blow from the very tip of your alveoli, right? The very tip. Now that in itself helps to push pressure upwards. So if you have a blockage, a lung collapse, that help significantly along with other techniques. So you have to also practice and ensure that you have an effective cough. You can also huff effectively, right? And as I say, we will go through the abdominal crunches, which is very important at this point. And the entire aim of all of this is to maintain and to achieve and maintain good bronchopulmonary hygiene. Now, physical therapy, we're not well known. I think a lot of persons don't really use physical therapy in the medical field. They don't. They think that's okay. Just give the medication and it works, etc. However, I beg to differ. No, physical therapists, right? They can literally tailor an exercise program for an individual who may have really bad diabetes, who may have really bad hypertension, who may have some chronic heart disease. You know, we can literally tailor, and not only tailor, but we also use the opportunity to educate and ensure that you follow a particular protocol. We don't not only just get up and say, okay, just get up and go run and whatever. No, it's never ever safe to do that. First, we set a baseline, and then we use a baseline to find out how far you can go, how hard you can go at a given time, right? So if you have a physical therapy buy, you should always go and ask them the question, talk to them, whatever you can do, just to, you know, get some information from them. I even have a good, close relationship with them. All right, so move on. Okay. Now, COVID pneumonia, right? So we see a lot of patients who have developed COVID pneumonia after being infected with COVID, right? But one of the things that I noticed is that unlike a regular pneumonia, COVID actually affects both lungs, not one, but both lungs. Now, if both lungs are affected and you're really sick, then you really need attention. So early management is the way to go. Now, with COVID, it tends to have a rapid development of inflammation of the alveoli, which may cause a buildup of fluid in this area, right? Now, this is where physiotherapy comes in properly. We have some techniques that we use. This one is called postural drainage. Now, as you can see, if you look at the different colors on the lung, right in the middle, you have different lung segments, and you have different bronchioles that's corresponding with the different lung segments. So literally, you can actually drain those lung fields. You can actually drain them. However, you can only drain them by changing the different postures. So if you look to the right, you'll notice you have different posture. Oh, sorry, excuse me. They have different way you could actually sit or lie so that the different area can be drained. One of the things that we use as physical therapists is that we use a combination of posture with various techniques such as Dr. Hunter would say cupping, but the actual name is percussion, manual percussion. So you literally hold your hands like this, cup it like this, and this is how it's supposed to sound. Not slapping. So as you cup, that energy is passed on directly through that lung, because remember, you know, lung is actually hollow so that air can pass through effectively. Now, as the energy is passed through, it then causes the mucus to unstick from the wall, especially from the smaller parts of the wall, right? And then it will then move more central, right? So that you can actually evacuate it through coughing or through suctioning. Now, here's the technique I was talking about. Manual technique, which is manual chest percussion. This technique, as I showed you before, cup the hand, it's actually used to mobilize secretion, right, from the small airways to the larger airways so it can be suction or evacuate through coughing. Now, when that occurs, it then causes an increase in lung capacity, therefore improving the gaseous exchange between the carbon dioxide and the oxygen, which then further down increase and improve your bronchopulmonary hygiene. Now, best believe it, you know, if you literally place the individual in the different position as before, which is the same postural drainage position, you place an individual. Let's use all right, let's use the image to the far right, the bottom image to the far right, where the person is actually on their stomach, right? Now, as you can see, the low zones there are the zones that are affected. When you put an individual in this position, and you can also administer what? You can also nebulize, right? If you have Ventolin or Atrovent or even the hypertonic saline, you nebulize with those, and then you ask the person, say, hey, especially if the person is coherent and can understand, you will say, okay, take a deep breath, you do the SMI, because SMI is very important. You ask them to take a deep breath and hold it. The moment they hold that breath, it actually literally opens up the airway. So the areas that are blocked, you can literally start percussing, percuss. And as it dislodges, it moves more centrally, you can then turn away. If it's that you want to turn away to ensure that you don't contract anything, you turn away. Ensure you have on your PPEs and your face mask. Are you wearing my N95 when I'm treating my patients? But yeah, so you literally turn away and say, okay, take 3 coughs. I'm gonna take a deep breath in and cough 2 times, 2 to 3 times. Cough. When you look at the saturation machine, it actually moves just by doing the SMI alone. So when you even doing the SMI and then you percuss, that allows the airway to be cleared, right? And it's something that you have to practice doing. It's not something that's get up on and it works one time, because what happens with COVID is that you continuously have irritation of the lining, so therefore the goblet cells keep producing more and more and more mucus, right? So you practice this, it'll be good. Another thing that I found out is that persons who develop pneumonia, the lower zones of the lung are the areas that tend to be affected significantly because of gravity, the natural position. So therefore, if you use the reverse Trendelenburg, which is the upside down, the same one, but the bottom right or the bottom left, is perfect in terms of draining. If you can win the lower zones, I personally think if you can win the lower zones, the battle is it's already won the battle. Lower zones, right? So what we try to focus on lower zones as well as the complete patient. All right, so I'm going to move now to vibration. Vibration is another technique that we use. If you look at the top right, you will recognize these are some vibration suits. We don't have these in Jamaica per se. We use the machine that is at the bottom right is the machines that we normally use. However, the principles and the techniques are the same. Now with mechanical vibration, what happens is that you have a rapid vibration which breaks the bonds and make the mucus, make the thick mucus less viscous. So as the bonds are broken and it's less viscous, by the time you cough, along combination with percussion, combination with SMIs, combination with just some deep breathing exercises, you literally evacuate all that mucus. You understand? Evacuate all that mucus. Now, the vibration also helps some cells in the body called ciliated epithelial cells. Now, the ciliated epithelial cells are basically cells that are important, very, very important. What they do is literally bring trapped mucus up from the lung straight up the trachea straight to the mouth. I don't know if you guys ever sit down and you just sit down and you recognize that, oh, you just have mucus in the mouth. You didn't do anything. This is what happens. The finger-like projections move really fast and they trap the mucus and they bring it straight to the airway for it to be evacuated, right? And persons tend to cough it up. No, the vibration actually increases the sweeping action of the ciliated epithelial cells, so therefore making it more effective. Other techniques that can be used, we have several techniques. I can't talk about all the techniques, but there's this one in particular that I like. You have one that we call the sustained maximal pressure, right? So with the sustained maximal pressure, it's literally you adding pressures to the diff over the lung field, right? So let's speak for example. Say I had a lung collapse to say the right side, right lower zone, for example, and this person is literally having decreased chest expansion. So as the person breathes, you literally can see the chest moving slowly. However, the right side is moving better than the left side, so you know that okay, something is wrong, right? So you normally get probably X-ray to confirm, or CT, etc. Now, one of the techniques that we use is a sustained manual pressure. Literally puts a small amount of pressure. So this area here is the area that is collapsed. What I do is I inhibit the movement of the entire opposite side as well as the upper side that is okay. And I give a little pressure and ask the person to take deep breaths in, SMI, deep breaths in a hold and release. And I even ask them to cough. Now, the lung is, or even the alveoli is, it has designed in such a way that, you know, it helps with situations like these when there's a blockage. You have something again called collateral ventilation, where, as you can see on the top right, you have, those are two alveoli right there. Now, if one area of the alveoli to the left, say, was blocked, right, above where the collateral channels are, what happens is that that increased pressure literally forces air through that collateral channel. And as that collateral channel, the air flows through that collateral channel with a huff, with a cough, with PEP, which is positive end expiratory pressure, it causes the fluid literally to just boom, right up, reopen one time. And you just do a deep breathing to maintain. And you continue the same thing over and over and over, right? So right now, in terms of using the sustained manual pressure for lung collapse, very important, and it actually works. Now, there's another thing that, you know, happens by using sustained manual pressure. When we breathe naturally, the air enters the body directly. So it comes from the atmosphere, straight to the body, straight to the lungs. Now, when you add pressure to that, what you do is literally increase the pressure within the lung. Therefore, if you increase the pressure in the lung, you then therefore increase the occurrence of turbulence or even collision. And collision refers to the air actually colliding with the particles, the mucus particles. Therefore, and as air goes behind it, it's just natural for the body to say, oh, airway is being blocked and I need to cough to clear the airway, and you just start coughing. So that is another thing that actually works pretty well, that compression there. Now, it also facilitates the inflation, right? It facilitates, this technique also facilitates the reinflation of the collapsed lung fields. Now, you have another technique called the intercostal stretches, right? And this is it's a technique that we use to actually, if the person cannot take a deep breath in, what happens is that we literally hold the rib. As you can see the pictures to the right. We literally hold the ribs and we push downwards. The moment we push downward, the reflex of the intercostal muscles is just to rapidly contract. As it rapidly contracts, the rib cage moves up and out, causing the person to take a deep breath in. Now, I don't know if that's not amazing. I personally think it's just amazing how the body works. And, you know, I just find that these techniques are very effective in management of, you know, COVID patients, even patients who are unresponsive. You know, some of these techniques are techniques that can work, that can make a big difference. But guess what? Early home care, early management is definitely the way to go. By doing this, you reduce the amount of effect that you would have had if you never did anything. Listen, I had an example, I had a patient. I'm not going to forget this patient. She actually died, but I was upset. I was very upset because of the work that I put in. What happened is that she was unvaccinated as well. But that's not it. She called us, right? She called me saying that the reason why she called was because her friend had died from COVID. So she had all the symptoms, the shortness of breath, the coughing, the, you know, increased heart rate, had everything. So the moment I went and I started working with her, the first day, I spent a good, you know, 2 or 3 hours. But guess what happened? After that first session, she was actually sitting at 70s. After that first session, it actually went straight up to 90s. And they would say, okay, no, we got her some oxygen and we start working. But guess what happened? She reacted too late. It was just too late. So we actually eventually had to send to the hospital. When we sent to the hospital, that was it. You know what I mean? And I was upset because of the reason that she gave me, why she decided to seek help. You know, and I mean, it could help. We could have literally saved their life if it was early. And if we had seen her earlier. Now, we're gonna go into the long-standing, not really going into it much, but we recognize that even after recovering from COVID, these are things that people battle with on an everyday basis. Fatigue, shortness of breath, difficulty breathing, coughing, pain, memory, concentration or sleep problems, muscle pains, etc. And list can go on. Now, this at this point, you know, you definitely need a specialist in the area, this area. As long as you sought proper diet, sleep, etc. Whatever medication that you need from your doctor, you go. But at the end of the day, what we need to do with a patient that has these stuff is literally put them down, find out what are their routine, a day-to-day routine, how they function. You understand? Because at the end of the day, you can't sit down and expect to recover. You have to put in some work. And putting some work means eating healthy. You're doing an exercise at home, whether it be cardiopulmonary, whether it be cardio exercises, but you have to put in the work. If you don't put in the work, you cannot expect to get good results. You have to put in, you cannot sit down and expect to just recover, right? We have to put in the work. So that's basically it for me as it relates to my presentation. Yeah, thank you. So if you have any questions or comments, you could let me know. Thank you very much.
Thank you, Andre. Thank you. Excellent presenter. So credible. You speak from the heart and from a place of experience. Can you just stop sharing the screen for a moment? Let's have a quick chat with you about some of the truths that you have spoken to. Just stop and
I'm trying to figure it out. Okay.
At the top should be. Or
stop sharing. Yeah, there we go.
Good. Yes. So yeah. So here we go. So you touched on very important techniques in terms of how to drain the lung, but physiotherapists were, like the dentists, are very much at the forefront and still are at the forefront of COVID. That the nature of your work brings you in direct contact with COVID. Have you heard of any physiotherapists who have died from COVID?
None.
Okay.
I've had one guy who probably was ill, but I think he had some issues before. But apart from that, none. Nobody was hospitalized, none.
Is it fair to say that most physiotherapists have had COVID by now within your circle?
We don't even know because I can't say. But I can tell you for sure that I've experienced symptoms in terms of running nose and stuff. And I remember one day in particular, I had a temperature. I've been treating my COVID patients, and I had a temperature. And I was like, Andre, this can't hold me down. You know what I did? I jumped on my bicycle and I rode out Kingston. 2 days I did it. I rode. Instead of third day, I never had any running nose. I never had anything. I felt brand new.
Excellent.
And because I pushed my, I just because I've been an athlete all my life. Play football every day. So it's amazing how just being physically active actually helps.
Absolutely. And you touched on it earlier, where several footballers would have gotten COVID by now, and none died.
None hospitalized at all.
Sports is not the problem. It's actually the solution, isn't it? We should keep reopening sports and stress sports.
Yes, I agree. For me personally, I think personally that we should have, really continue to stress the importance of being physically active, because if you were to check the numbers in terms of person died, you definitely see persons who are obese died. And I'm not just talking about Jamaica. I'm talking about worldwide. New York, most of the persons who died were obese. And when I talk about obese, we're not necessarily talking about some person, not necessarily big belly. You have persons with big boobs. For the men, you probably have big belly. You understand? So protruding abdomen and stuff. So it varies, but one has to understand and make it their own responsibility to deal with themselves, And you just have to be real. You just have to be real and fair with yourself. Listen, even if you go and say, you know what, like me, I can't tell lads I eat rice. I decided to just cut. I said to people, sometimes you just have to eat, not necessarily for taste, but for the nutritious value. You eat your vegetables, you eat what you're supposed to, your spices, just the nutritious value, because at the end of the day, you're just thinking about the benefit. The benefit is what I think about when I eat. I don't necessarily think about being, you want to basically
the KFC.
You have to eat for the benefit.
On KFC, right? But it's really important that we become conscious of what we eat, not just to be in love with what we eat, but to really be conscious and to think about what we eat. And that's why certainly we support, and I think everybody in here supports the frontal packaging, black octagonal, high high frontal packaging label for our foods, because I mean, we said that, okay, it's all right to smoke cigarette, it would be an uproar. Actually, our foods kill us. Our foods actually kill us. And funny enough, cigarette smoking has not featured heavily on any risk factor for COVID. But guess what? Obesity has. And
Exactly,
obesity
which is
directly linked with what we eat.
yeah, which is it's very ironic. I mean,
We don't
who would have
advocate
thought?
cigarette smoking, of course.
But I mean, there's one thing in particular that I'm going to hit back on. You know, as it relates to our children, we need to seriously pay more attention to their diet, because we know that we're children in this generation is not like children in your generation, where we get up and go outside and we play cricket, football, basketball, and and then we do schoolwork and stuff. They don't do that. They sit on the tablets, they sit in front of the television, they get the KFC, the pizza, and they're just spoiled. But guess what happened? When you look in the hospitals, you see the hypertension, a little baby hypertension, little 5-year-old hypertension, little 5-year-old have diabetes. You know what I mean? And these are things that we could have avoided. You understand? If we take the right approach. I mean, I think the government started out well in terms of they actually reduced the like sodas and sugar and juice and things, right. So we just need to actually pick up where we left off and continue on that trend, because
I love that. I love what you just said. Pick up where we left off. That's key. Exercise,
because guess what?
make the moves, cut the sugar.
At the end of the day, if we don't, and to find that we're gonna have an aging population, and not a very young population, an aging population, because the older people are gonna outgrow the younger populations, because they're the ones that are gonna be dying from diabetes and obesity and all those stuff.
Last year, the figures finally came out a few weeks ago from the RGD that the #1 killer of people in Jamaica, and I suspect this is also reflected in the Caribbean and the Western Hemisphere, was diabetes mellitus. Yeah. Diabetes mellitus. Nearly 3,000 Jamaicans died from diabetes mellitus. Not cancer, not heart attack, not stroke, not hypertension, and definitely not COVID. Diabetes, uncontrolled diabetes mellitus, and a horrible condition. A colleague of mine just commented. He's a consultant kidney specialist, and he sees a tragedy with dialysis. And he said, you know what? Sometimes it's better to have HIV and stay on your meds than with diabetes, which is such a horrible journey with diabetes and Medicaid monitoring, the kidney failure that they do. The journey is so hard and tough with diabetes. So that's why we try to stop certainly the type 2, stop it from happening in the first place by looking at our diet. And it's interesting how you approach your COVID by getting on a bicycle and just hit it hard, hit exercising. I mean, I won't recommend.
What am I waiting on?
Yeah.
What am I waiting on? For it to take over? No, listen. There's a truth. There's a principle there. No, I don't remember if you must know this. When you were younger and you got a normal flu, you used to hear people say, "Hey, put on your shoes, man, and go and run it out." There is a truth to that.
Yes.
And it works.
For some people, sure, but by and large, we would be a bit cautious. Of course, rest is important because myocarditis is a risk factor from COVID as well as from the vaccine, but more so from COVID. More people have myocarditis, and with myocarditis, which is an inflammation of the heart, that you really need to be in a bit of a rest and hydration and be calm. But yes, you need to get a balance with exercise, even deep breathing exercises. SMIs, maximum inspiration, forced expiration, coughing, postural drainage, percussion. These are very important.
And I must say also, you see, when a patient comes to you as a doctor and says to you, "Oh, doc, I have a problem," you sit down and say, "Okay, these are the things that you have," and you analyze and you prescribe based on that. Now, a physical therapist, what we do is literally sit down and write exercise prescription based on condition, all right, and based on difficulties, so that we tailor it just for that individual, ensuring that you do not step too far out of what you're able to do. Because obviously, if you go beyond what your body can actually do, that's a red flag there, and you might just
Diabetes is really a dreadful disease, So we must go back to where we were on message. cut sugary drinks, cut and listen, it's time for us to get those labels, those high frontal packaging labels on the packaging, because we know what's killing us. The food, what we eat is killing us. Our lifestyle is killing us, and we need to get on and log on. It's either we decide that, okay, we're going to remain in our metabolically unwell state so that when we get COVID, we are so distressed by it, or we're going to be like the footballers, like you, to become more metabolically fit, drop 20, 30, 40 pounds. Very important. Andre, I'd love for us to continue this discussion, but you're going to stick around for us. We have to move on with the conference. We're going to hear from some more excellent presenters. Thank you. It's been really inspiring. We're going to have you again in the future. Thanks for coming. Thanks for sharing. But stick around.
Thanks for having me. Yeah.
Have more discussion. Thank you so much.
Thank
well,
you.
We move on now to Dr. Michael James, senior family physician in Ocho Rios, on mainstream Ocho Rios, and he is going to share with us his experience so far. He has given tremendous support to the conferences over the past few months, and we would like to hear what's happening in Ocho Rios, what's happening at the level of his practice. So, Michael, over to you. Can you unmute and let's have you.
Can you hear me?
Yes, loud and clear, and we have a good view. Yeah, go ahead. Yes.
All right, great. All right, I'm not sure where to start, but I suppose where I left off from the last time we had our meetings. So far, I've seen over between 300-400 patients, and believe you me, it has been an experience by itself. I mean, I've learned a lot and how to manage people with respiratory distress, especially the COVID patients. My takeaway from, and this is going to be a brief talk, right? Just to tell you, my takeaway from all of this experience is that early home management really works. And if you are going to have somebody who has COVID infection or COVID infection, viral infection, then you have to start them early on treatment. And the treatment that I've adopted and have carried through has helped me with everybody, all the 400 or 350 to 400 patients that I've had to see. And I've only had 5 persons who died, unfortunately. And that was from the very start when I was in limbo as to how to manage these patients and then when I met Dr. Roger, I mean, that spurred me on to continue to doing the things and the steam inhalation and all these things that helped as well in the management of the patients, acquiring a pulse oximeter. But certainly recognizing early symptoms was the forefront. And once a person had a fever, had a headache, feeling unwell, any shortness of breath, loss of smell or loss of taste, or even when they come with sinus drainage, which is one of the excuses, they say, "Doc, my sinus is draining, so give me some sinus medication." I said, no, let me go. And most of them, when they have their things checked later on, their COVID test done, they come back positive. In the early part, they would be negative, but certainly in the latter part, they would be positive. And so what I do is once they have all these symptoms, and I start them on medication, and I go as far as once one member of the family has it, then I treat everybody in the family. And guess what? Everybody is all right. Even when one member has been shown to be positively tested for COVID, and they were sleeping in the same bed with their husband or wife, or their children in the house, or grandparents, or whoever, everyone gets treated. And everyone gets okay. Nobody gets sick. And this is preventative management. So it has come in quite handy, and I've done well, and everybody is happy. And most of my patients, the ones that I've had to send to the hospital, have all come back normal because I've started them on the medications. And you know my medications already, it's quite easy. The ones that I do is put them on the B complex with their zinc, vitamin C, vitamin D. Of course, the quercetin is a transporter that helps the vitamin C that gets in the cell, that helps to block the virus from replicating or entering the cell itself. And of course, their fluids is important. And this is where the honey and tea comes in. I'm glad we probably didn't have quercetin tablets, because when you drink onion tea, you have to extract that thing and you drink the fluid with it, it makes you hydrated as well. So it comes in handy. So in addition to the ivermectin, all these are important attributes. And I found that I don't really have to calculate the dosage of the ivermectin anymore, because once I have them on 12 milligrams as a single dose, one single tablet can be 12 milligrams. Once I have them on that 12 milligram tablet and I give them one initially, irrespective of your weight, you know, you have to try to experiment and see what works and what doesn't work. And people have been doing just the same way, just well. So 12 milligrams, standard dose, one day one, and then skip a day and the day afterwards, you get another 12 milligrams. That's quite good enough. And it works. And also, I must say, and this is just my own figuring out of things work. Even when persons have had a PCR test done, and they are positive, and when I repeat that PCR within the first 10 days after giving initially COVID, I've done it on 1 or 2 because it's very expensive. And the clinic does it, but it's time consuming as well. But once they have gotten the ivermectin, I find that they become negative as well. They are negative after in about 10 days, and which is a good thing. And that means that I'm just thinking here that they might be shedding the virus at the same time when they take this medication. And so it disappears. The immune system has not responded yet or something, but it's not there. So this is how I've been treating my patients, and it has done well. And I plan to just have this medication available. I mean, even though other people have been quarreling against it, and some people in the community, you know, or medical community has things to say against it, it works, and I find it works quite well. And people have been asking for it, and I've been giving it to them, and they have been doing well. All right, that's my short take and brief preview or review of what has happened in the past.
Thank you.
Thanks.
Thank you, Michael. It's really an amazing journey to see improve. And so your outcomes have improved as time has progressed, isn't it? If through shared learning, we have become better at it, isn't it?
Yes, it is. And I mean, I'm glad, you know, the pulse oximeter is one great thing as well, you know, because I've had to, once you come in and you can put that pulse oximeter on, even though they say that they have a sinus infection, you can see that their oxygen sat is very low. You can know that a respiratory thing is going on. So you just put them on the medications right away and don't delay, because early treatment works.
Absolutely.
It gets it going. Yes.
I mean, Donald Trump is a good example of how we can early treat. The minute his SAT fell to 94, he was admitted to home. And what do I mean by that? He was admitted to the suites. The hospital was turned into a home. There are 6 suites at Walter Reed Memorial Hospital. They turned it into a home environment, and he was admitted at that. Of course, he really wanted to get back home to the White House, but he really responded excellently to early treatment, even though he had so many metabolic conditions: obesity, heart disease, we said cholesterol, high blood pressure. So Donald Trump was not necessarily the fittest of persons, but he was treated early, and that is what we're seeing, isn't it? I mean, early treatment matters.
Early treatment matters. Well, it's not Donald Trump this time. It's my local friends and families and all the little people that have been going around getting their groceries and doing their own things and getting it, you know.
Absolutely.
And the family is better for that when they get early treatment. Yeah, man.
Excellent, excellent. I don't think, I mean, we're seeing where our colleague in St. Lucia, Dr. Gilberta St. Rose, has been, you know, unfairly treated, harshly treated, and we should support her for using ivermectin. And it's so sad that she's been brought up to the, you know, to the authorities in St. Lucia for the use of ivermectin. And I mean, in Jamaica, everybody's using ivermectin. What say you on that? Can you say?
I mean, it's ivermectin. I mean, from the very fact that I have found this gem that has been around but not being used, it has been touted as being horse drug and all sort of things. But it works. It is proven. I've proven it over and over and over again. It does work.
First used in humans, then it was transferred to animals.
Yes, it was used in 3.1 billion persons already, and no side effects. It has been touted as one of the safest drugs. and it has been given a prize for that. You know about that already. Yes.
Right. Excellent. Well, I mean, my brother, my friend, continue to do the amazing work. I think primary care physicians have now taken control of this narrative. You're now at the forefront. You are the true frontline workers, in my opinion, along with so many others at the hospital level. But the first interaction is usually with your family physician or in a primary care center. And so this is the opportunity to get it right by early treating and preventing hospitalization and death. Early treatment prevents hospitalization and death.
So my take with all of this, and I'm telling everybody, once you can start early treatment, don't be shy, don't be reserved, don't put yourself in quarantine, please, or lock yourself away. Have early treatment. Get some advice, some direction, and early treatment does work.
Thank you. Thank you. Thanks again. Brilliant. Amazing talk. So much. All right, Michael. Thank you. Dr. Leroy Heyman, can we have you presenting, sir? We're eager to hear from you. I'm itching to see what's happening in May Pen over the past month or two since we've last had you talking. Can you unmute yourself, sir, and enlighten us with your presentation? Dr. Leroy Heyman, are you ready for us, Sir Leroy?
Yeah, good night, everyone. And thank you, Dr. Hunter, for inviting me to be a part of this presentation tonight. Just bear with me for a minute while I get my screen up.
Yes.
All right. But most of the information that we have has been almost near 2 years of medical knowledge from the virus was discovered in Wuhan, China in the latter part of 2019. And I mean, November, December this year is almost 2 years since we have gotten the virus infection, and it has been spreading globally. I would love to get this thing going. All right, just bear with me one moment. Let me see if I can get the screen to be shared so those who have their various mediums can see the slide. All right, just bear with me for 1 minute, Dr. Hunter. I'll be back soon. All right, 1 second.
You want me to go ahead? And I'll probably go ahead and do my presentation now, just in the interest of time.
Okay, go ahead. Yes, go ahead.
Right, I think your background, right. I'll just go ahead and do mine. Mine is pretty much focused. Here we go. Share. Can everybody see this? I think most people have seen this already. And yes, good night, everybody. I'm going to go through this quickly. Most people are familiar with this talking. We're slowly putting together the Association of Jamaica Association of Independent Public Health Providers, JIPHP, and we'll move forward with that organization or association in the future. Dr. Hunter, I'm a consultant neurosurgeon and spinal surgeon, and for this year, MAJ President-elect nominee. There I remain. I was not granted the presidency this time around. Okay, now healthcare in Jamaica has been focused around institutionalized services, where in fact we have seen even people with very mild sickness gravitating towards a hospital, and that has really not been the best model for us. We have seen also the heavy use of oxygen. Oxygen is actually a drug and really should be rationally used. We've been able to treat patients without the use of oxygen with our models. We have seen high positivity rates of 27 up to 50%. And with that, we know most Jamaicans by now would have had exposure firsthand to COVID. And perhaps that also speaks to why our numbers are declining. But we really would try to emphasize that we need to have less concentration of institutionalized care and more devolving care into the community and empowering people so that they can do what they can do early and do it at home and avoid hospitalization and death. It's also cheaper. Hospitalizations were extremely high, over 100%. And we know hospitals already had problems with equipment. This just made it worse. Short-term contracts made it worse. Doctors didn't come back, didn't re-engage with their contracts. And really, it's really sad what happened. By now I've treated well over 500 cases directly and indirectly using algorithms, and we have treated you received tremendous success with only one clear death attributed under our care, although that person did arrive late. We also had a 104-year-old nurse who is alive and kicking, and we are very grateful for that. And of course, we have treated some young and tender age children as well who have also lived. Everybody must know by now, if you've been following our early home-based model, everybody must have a pulse oximeter in their home. Pulse oximeter is absolutely crucial to the successful treatment of COVID. Everybody must have this. An oxygen saturation meter, you must have it at home. And once you get 95% and above on the SpO2, the percentage oxygen saturation, that must be 95% and above, and ideally 99 or 100%. All homes must have a pulse oximeter. All homes must have an infrared thermometer. All diabetics must have a glucometer. Every home must have a digital scale. We must measure your weight, not just in terms of measuring, your dosing for ivermectin, trying to figure out per kilogram dose of ivermectin, but also in helping to control your metabolic conditions. We must log on to what's happening with our weight. We must manage our weight, and that is indexed to the amount of physical activity that we're doing. Is also indexed to what we're eating. This fast food needs to stop. Fast food restaurants need to reimagine their diets, and we need to have labels, high frontal labels on our packaging. All the packages must have the labels to say that this is the amount of salt, this is the amount of sugar, and it's bad for you. What's killing us is really what we're eating. Home-based treatment works. We know it works when you're guided, particularly with a doctor. I've allowed my number to be readily available. Most people by now have my number, 361-2686. I continue to allow it to be available because we know we're not quite over the COVID crisis as yet. We are grateful. We see that the COVID numbers are falling. Our positivity rate dipped into single digit figures this past week, and our mortality rate is down to 2, 4, 6, 8, 9 cases per day, and that clearly suggests elements of people logging on to early home-based treatment, earlier treating rather than watching yourself and doing nothing at home. You're treating early. Also, a number of people have gotten COVID and developed herd immunity. We know that we can't attribute the fall in the rates to vaccination. If we contrast ourselves with the UK, UK is practically fully vaccinated, and yet their numbers are rising as they enter into winter. The deaths, most people who die in the UK from COVID are fully vaccinated. Yet Jamaica, despite being unvaccinated or a little low vaccination, our numbers are falling and our death rates are falling. I think early home base is actually doing a wonderful job. We want to recognize people like Dr. Jacqueline Chambers, Dr. Shirley Lee, Dr. Jermaine Spencer from the West, who are doing a great job treating people early, Dr. Leroy Heyman, Dr. Vernon Jones, many others, many others. When to start immediate treatment? We must start immediately based on suspicion. Remember, we gave example at the beginning, and for those who are late, we want you to know that this is also being live streamed on YouTube, and we're asking you to go back to YouTube. You can please all subscribe to the video, like, share, and subscribe, but you can go and watch this conference from the very beginning. And I tell you, the beginning is just as important as the middle and certainly at the end. So we want to go back to the beginning. When to start treatment? Early. Remember, the negative test is a false reassurance. Many people have negative tests, but they still have COVID. Do not be reassured by a negative test. Remember that you can have COVID. Once you have symptoms, even if the test is negative, you should treat according to your symptoms. Start treatment from day one if possible. I was able to treat from day one because I was very in touch with my symptoms. When I treated a doctor and a nurse, I felt the symptoms, that boom, a fever. I don't normally have a fever. Immediately I started treatment, and I'm glad to say that I'm here today. Every household must start treatment early. And with a 50% positivity rate or higher, we know most households in Jamaica would have had COVID inside their homes. We must not keep it a secret. We must tell someone, tell everyone, go and tell. We must rest as well. I know Andre, our physiotherapist, was able to embark on a rigorous physical exercise, but we also need to rest as well, to balance exercise and rest whilst we get over COVID. We must keep hydrated, but we must have regimented oral hygiene. Regimented oral hygiene. This is absolutely crucial to the successful outcomes of COVID. We must at least brush our teeth, floss, brush, Listerine 3 times a day, and that process should take at least 5 minutes. Do not rush it. You must take at least 5 minutes. I have advocated more and more steaming for a longer duration. I know I've seen patients, we've had a few burns, but in the end, they've all lived. All the burn patients, they still have lived. They're alive because the steaming really works. It gets down into your system, and you can't steam for 10, 15 minutes. It's not long enough. You need to steam for at least 30 minutes with menthol crystal. Get under the sheet, immerse your entire body, create a little mini sauna, and inhale that menthol. I, by and large, recommend the menthol as a number 1, 2, and 3 choice. Of course, you have eucalyptus, you have other things you can steam, but the heat, the virus does not like the heat. So we want to encourage steaming and hydrating before you steam. A lot of the patients that I've treated, and I've treated some very, very sick patients with COVID, extremely sick. People have blocked out, people have passed out in front of me. And I've had people that we've had to be giving 14 bags of IV fluids just to bring them back into a state of balance. That's how dehydrated you become when you have COVID and you're watching it and not treating early. But it's very important to hydrate, especially before you steam. Rest. I can't emphasize that enough, but we need to hit it hard, and hit it early. No time for pride. Tell everyone, yes, help. I have COVID. We need help. This is how, once you see symptomatic, you start treating early. What are the symptoms you should look out for? Headache, cough, loss of smell, loss of taste, tiredness, fainting, blocking out. That can be a presentation from COVID. Aches, pains, diarrhea, chest pain, just feeling a bit unwell, little out of it. That's enough. A little runny nose, a little stuffy nose, a little itchy nose. That can be a symptom of COVID. Sinus, that's a bit more. Shortness, wheezing for the first time. Those can be symptoms of COVID. Palpitation, fluttering in the heart can be a symptom of COVID. We must be very familiar with the symptoms of COVID. Remember, this program is also being on YouTube, and you can always go back and see this program as well as others in the past. Remember to like, share, and subscribe. Everybody, you cannot do this alone. Go and tell. The church really needs to be very open to all its members and those outside of the church. We need to reach out, and we need to share, and we need to be our brother's keeper. Lots of fluid, 4 liters per day minimum to get your system well hydrated. That if you get COVID, your secretions are thick and viscid and hard to get up. It's easy to get up once you're well hydrated. This is an example of how we steam of the facility that we at a home, of steaming at home. And of course, you can put monitors at home. Nothing wrong. You can put your bed at home as well. There's an example of somebody steaming.
Maximum.
And this is what I would encourage everybody to do. Get under your sheet. There's a hot bowl there with menthol, and the person is immersed and steaming and getting the secretions up. And we also have to hydrate someone. For some people as well, you have to hydrate them to get their secretion thinned up. Deep breathing works. You can get your oxygen saturation up to 97%, up to 100% without the use of oxygen. This is what we're fishing for. We're fishing for this. We're hunting for this. This is important. Oxygen will not get this up. No amount of oxygen that you blast on the high flow will get these plugs up. It has to be the physiotherapist. It has to be hydration, has to be steaming, has to be deep breathing, has to be postural drainage, turning upside down, going prone, cupping the chest, very important, very important. And this will be your reward, getting this thick, frothy, viscid secretions out. Now we have developed this algorithm chart, which is freely available. What you should do from slides 1 to slide 6, and you'll see here where at slide 1, it tells you about the symptoms, it tells you about the equipment that you should have at home, including the digital scale, including your glucometer, your blood pressure machine, your thermometer, and finger pulse oximeter. I must say that COVID has allowed us to become more medically literate. You're hearing about PCR, antigen, antibody. We're talking about oxygen saturation. We have been taken to school over the past 20 months. We have to learn our lessons and use this medical knowledge that we've acquired going forward in the future. Do not forget it. These slides show what you should do before steaming. Drink a lot of 3-5 large glasses of water. Drop as much as 5 to 10 menthol crystals per sitting in a hot bath. and put a towel or sheet over your body. During steaming, you want to deep breathe, sit cross legs if you don't want to, but deep breathe, cover your head and your whole body. Minimum of 5 to 10 menthol crystals in hot water. It may be hard, take a 1 minute break and you should go back at it and steam again. And then cough while you're there, cough and cup your hand and cup your chest, get somebody to percuss your chest. Pulse oximeter, once you're above 90, we're okay, but we prefer it to be 95 to 100%. Steaming with eucalyptus or menthol is important. 20 deep breaths every 3 minutes during steaming. 20 long deep breaths, SMIs. Maximum inspiration. Maximum inspiration is important. Slide 5. What about our temperature? If our temperature is high, above 99, we cool drink, fan, tip it sponge, get that temperature down. Hydrate, hydrate, hydrate. Panadol, 2 Panadol tablets as well. You must practice regimented oral hygiene, brushing your teeth 2, 3, 4 times for the day. When we step up to the slide 6, we're talking about a doctor here to give you blood thinners such as Xarelto. I prefer Xarelto, also aspirin for the milder cases, but also Eliquis, Pradaxa, and Clexane. I like the injection of Clexane. You can do it just like a diabetic gives himself insulin. You can give yourself Clexane injection depending on per kilogram weight. That's why it's important to have a scale at home. Dexamethasone is a steroid that we use of choice. You can give it intravenously or orally. Antibiotics, Citromax does a job, but also levoflox can be used for 7 days, not 3 days. You need for at least 7 days. Clindamycin as well, 600 3 times a day. Those are my favorite antibiotics to use. Ivermectin, I'm a strong proponent of ivermectin as well. We recommend ivermectin, 15 milligrams start, then 15 milligrams 2 days later, and 15 milligrams once a week. You can also give 12 to 15 milligrams daily for 5 days and then stop. Monoclonal antibodies and interleukin-6, Actemra. We'd like to have Regeneron here in Jamaica and across the world. We hope America will get Regeneron out into the world so that we can treat early and get effective results like with Donald Trump. It'll be interesting to see Major General Colin Powell's pathway, who was also taking a water read, to see just how early he was treated, having been doubly vaccinated. There's a tendency to be doubly vaccinated and have this, okay, I'm doubly vaccinated, I can't get sick. I'm doubly vaccinated, I won't be hospitalized. I'm doubly vaccinated, I won't die. And so that inertia can be very deadly. And by now, many people would see several Jamaicans fully vaccinated have died. We recommend the vaccines, but it's not enough. If you only rely on vaccines, you're going to lose the battle. And despite our low vaccination rates, our numbers are actually falling. Very important to think about the strategy going forward. This is an example of how we can posturally drain by heading down. If you can go head down, that would really, really important to get the chest downwards. Oxygen saturation 100% after just simple maneuver like that, going prone and head down. Get this sort of things out, get them out of your chest. Check your O2 sats liberally. This device, you can take it you can keep it on all the time, like you do with a sleep test, or you can do it intermittently as many. It's painless, pain-free. It's easier to read than your blood pressure, easier to read than a glucose reading. The government needs to provide a therapeutic headline or helpline. I think by now our services have reached many, many people. I'm so warm to when I hear that people say, you know, doc, I've learned this technique from you and I've been able to help so many other people. And you're going to hear those testimonies tonight. Everybody must have a pulse oximeter. Everybody must practice good oral hygiene. Everybody must steam with menthol where you are exposed or you actually have COVID. Pharmacy, you must know where the pharmacy is. All teachers must have a doctor's number, police, civil servants, police officers, all residents. It can be life-saving. Just giving a message by YouTube is all that needed for the majority of people. Not YouTube, by WhatsApp. Giving a message by WhatsApp can be enough. If you follow those slides, you can do a lot of good in that regard and be able to save yourself. You must be able to get to a pharmacy. You must be able to take WhatsApp prescriptions, telephone prescriptions. Note the closing times of pharmacies. We know that there's an easing of the Sunday lockdown to I think 8 p.m. now closing time. So we need to be aware of these things. Sunshine, we have a lot of it. Please use it. The Northern Hemisphere is going into winter. We're in the tropical zone, but we're not going to get we're not going to have any lack of sunshine. We should use it, and we should welcome people who are in ravaged lands. We should help them here and help them to come and heal in the sun. And something that I stand by and certainly would suggest that we we be our brother's keeper and help those countries that literally have no sunshine going as we go towards winter, or a little sunshine. Oral hygiene and steaming, nasopharyngeal pathway. It's important to again emphasize that COVID is a disease that loves dirty mouths. It loves to get into our bloodstream through the gum. And so if we use Listerine or other mouthwash, chlorhexidine, betadine diluted, in contact with the virus is dead within 40 seconds. So if we gargle for 1 to 2 minutes, that's enough to clear our mouth and reduce our viral load. And not just the viruses, but also the bacteria, which we know they're also part of the problem. We must be metabolically fit. I hope this plays. But there's an example, it's not showing, of someone who is really exercising really well and enjoying the sunshine, enjoying the good weather. So familiar face, somebody who is really logging on to getting early home-based treatment and steaming and getting excellent results. Listen to another patient. This patient came to me collapsed. You'll hear from him later tonight.
I was a severe ill COVID patient. I realized that cupping, steaming, turn upside down, cup the back, they bring up a lot of mucus, horrible stuff. And I realized that oxygen wasn't necessary. Until now, I use no oxygen whatsoever. And I advise anybody in any medical field to try it this way. It works.
We want to advocate the rational use of oxygen. We definitely, there are people who will need oxygen, but it must be rationally used so that we don't have a situation where perhaps through managerial processes, we have a disconnection between oxygen need and the pre-ordering of oxygen. Early home-based treatment is important. It's convenient, it's cheaper, it's comfortable, it's family-friendly, it's privacy, there's dignity, there's less loneliness, the families around you. COVID is a disease of fear. The stress, the anxiety, the trauma, the fear is great. So if we can overcome that fear by being there, by doing it in your home, then what a wonderful thing we will be doing. And Igas Manez, one of my heroes from the past, who popularized frontal lobotomies by doing it in the kitchens of Americans. He's originally from Portugal, and there's a hospital named after him, ironically. But Antonio Catano, the Igas Manez, is certainly someone who I would recommend that we should listen to what he's telling us, what he told us from 50, 60 years ago, and for which he received the Nobel Prize. And what did Onesimus teach us? That those who, if you're exposed to the virus, that you can develop immunity. Black folk, minority, we love vaccination. We're not against vaccination. Perhaps there's a little caution around vaccines that we know aren't as effective when it comes on to seasonal respiratory illnesses. But what is clear is that vaccination was brought to the Western Hemisphere by Onesimus, a Black African man who was well educated, and is in fact his master, Reverend Mather, was almost killed by his white peers for suggesting anything could come from a Black person. That's good. Onesimus saved a lot of people from smallpox. And in fact, smallpox to date is the only illness, the only virus that's completely eradicated through vaccination. So it's not a battle with vaccination at all. We just don't get enough. What we want is early treatment. And the Tuskegee experiment, which you see here, conducted by the CDC, ended in 1972, was an experiment in not treating people, letting them stay home and watch and watch and watch and watch. And guess what? Many people died. Many of them died from syphilis, and see what happened. So the battle is about getting treated early, not watching. We need to treat early. How can up to 1972 the CDC be involved with holding treatment? It's a wicked and diabolical act and must be condemned in the strongest possible way. And we must not let ourselves be led to think that we should just watch a condition. Stay and watch it. Stay and watch it. We're fully vaccinated, stay and watch it. We're unvaccinated, stay and watch it. No, both vax and unvax need early home-based treatment, early local treatment as soon as possible in a dignified and a loving and respectful environment. all children must return to school. This is a bigger public health problem for Jamaica. We see the problem when 14-year-olds and 16-year-olds have children. We see diabolical monsters produced later on in life. It is time that we get our children back in school. Resist hysteria. Do not forget elephants in our room. Remember, diabetes is our #1 killer in Jamaica. It killed the most Jamaicans last year. Treat early. Using monoclonal antibodies, they can be given at home as well under monitoring. Treat early using ivermectin. Treat early using remdesivir, where in the mild and moderate cases. Home-based treatment is extremely effective and it saves money. Everybody must become COVID-enabled, COVID-empowered, COVID champions, and COVID competent. Thanks very much, everyone. Stop sharing. I hope that you are empowered by this message. It's a message that I want you guys to own and to go forth and to tell and to share with all those here and near and far. And remember, this is also available on YouTube. You can go back, like, share, and subscribe. Brother Leroy, are you back with us now? Are you up and ready to enlighten us?
Yes, let me get the slide going, and then I will start momentarily.
Okay. It's really important that we early treat. Early treat. There you go.
Okay. So for the past approximately 2 years, I've been navigating COVID-19, and as I mentioned in previous presentations, I practice in the central part of the island, that's in Clarendon, Jamaica. And my experience in dealing with the COVID-19 patients have been largely based on my medical knowledge over the past approximately 2 years, ever since it started in Wuhan, China. So my knowledge have been basically geared at focusing two things, mainly primary prevention in the form of the vaccines that we are given presently across the world. And secondly, we are focusing specifically on early treatment, which we believe is also an important part of the management of the COVID-19 infection. Now, as we can recall, in March of 2020, the coronavirus infection was declared a pandemic. And globally, as we speak right now, we have over 245 million cases. Our deaths globally is reaching near the 5 million mark. It's 4.96 million. Right here in Jamaica, we have over 88,000 cases so far, and our deaths, I think including maybe today's figure or yesterday's figure, is over 2,184. So here we see the large scale of this infection. And so it is something that we must consider very seriously. It's no hoax, it's no myth. Coronavirus infection is real, and it has affected millions of people across the world and has also taken many lives. So what I've learned past 2 years approximately, we have heard new words like waves. It has come in waves. So far, we have heard of 1 to 5 waves. Jamaica presently is having its 3rd wave. And I think based on what I'm seeing in October here, we are coming to the end of our 3rd wave. In the month of August and September, our positivity rate went up alarmingly high into the 50%. And but now we're seeing that it is falling off significantly. And so we are closing off our 3rd wave here in Jamaica. Other parts of the world, like Europe and the United States of America, they have reported their 4th wave, and places maybe like Iran have reported their 5th wave. So we are not sure if other waves are going to come here. I think everybody's hoping and praying that we will have no other waves coming, but we have to be prepared should in case it comes. We have learned also of various variants. The virus have the ability to change its form and its shape, especially the spike protein, which the novel virus it is. And so we have defined 12 variants right now from alpha to mu. And we have the mu variant and more importantly, the one before that one, the delta variant operating in Jamaica. The symptoms were mentioned previously, but here they are again. In the mild cases, we have seen mainly nasal symptoms, stuffy nose, runny nose. We have seen sore throat, headache, mild cough, and mild body aches. As the symptoms progress to moderate to severe, we get a more harsher type cough, productive of cold, sometimes thick mucus. We do get short of breath, we do get diarrhea, sometimes vomiting, and that of course leads to dehydration. We do get weakness. We have seen cases of chest pains and more severe pains. Now, I mentioned the risk factors here because I want us to remind ourselves that persons with existing medical condition or chronic comorbid medical conditions, your hypertension, your diabetes, your asthma, your kidney issues, your cancer, patients like those seem to have a very poor outcome. As was mentioned by our physiotherapist, also obesity is a very big one, and almost anyone who is obese with a BMI going over 30, we have seen in practice, and I see it right here in Maypen where I practice, that those patients do not do well at all. And in recent time, pregnancy, for some reason, pregnant mothers who get infected would need to pay particular attention because for some reason, which we're trying to find out, and we're trying to find out really, really fast, like it caused more severe organ damage. And so the outcome is not good at all for pregnant patients. Now, over the past approximately 2 years, medical science focus on management intervention, and we see two main things in operation right now. We have the primary prevention in the form of the vaccines, and we also have the therapeutic management. Now, when we look at the vaccines, there are 4 main ones available out there. We have 2, which are the mRNA vaccines, the Pfizer and the Moderna. And we also have the viral vector in the form of Johnson & Johnson and AstraZeneca. And so far, over 6,500 million doses have been administered worldwide. Jamaica, we're approximately 12% fully immunized or vaccinated, so we still have a far way to go. Very simple, based on the 2 technologies available, the virus, the mRNA or the adenovirus, the flu-like vaccine for the viral vector, it's injected into your arm. It goes into your cells. Your cells are given instructions, or the vaccines are given instructions to produce these spike proteins that resemble the one on the novel coronavirus. Having done so, your body recognizes those spike on the cells and see them as foreign. So it produces protective cells and antibodies to help you fight if the true coronavirus comes your way. So that's basically how these vaccines are prepared and what they do. As far as we know, the mRNA, once it has given instructions to produce the spike protein, it dissolves and it has no further part to play. So very important, it's not DNA material, so we do not expect it to damage your cells. Also, These technologies have been around for a pretty long time. The mRNA has been around since, I think, 2008. It was formally tested in HIV and the Ebola virus. So the technology has been around, but they kind of master it and add more technology to get the coronavirus vaccine with the mRNA, and also the viral vector in the form of the adenovirus. Those technologies have been around for a while. Now, in my medical practice, the vaccines do come with side effects, but more importantly, they do work. They are given to produce the spike protein. Your body produces the antibodies. These antibodies are real. When you get a true coronavirus infection, these antibodies will fight for you. So what I see in my practice is that persons who are vaccinated, they get less symptoms, they get less need for oxygen therapy, less need for hospitalization, and indeed less death. So that's what they were created for, and they're doing their job tremendously, as those who get the vaccines and do get the coronavirus infection, they recover during a short period of maybe 3 to 7 days. So these are some of the local things we see in our offices. Pain at the injection site, flu-like symptoms, a little stuffy nose, runny nose, sometimes coughing, headaches, joint pains, nerve pain. We do see palpitations. We hear of chest pains, Pfizer especially. We have had a couple of children coming down with myocarditis, chest pain. We have fatigue, which can be prolonged. And in other parts, we do see clotting to the extent of deep vein thrombosis. I've not seen any stroke in my practice in Maypen, but we have heard of them. We have heard of cases of dizziness and blurred vision. We have heard of cases of prolonged menses. And one of the big questions people are asking, what are the long-term effects of these vaccines? The truth is that we do not know what's going to happen tomorrow. We do not know what's going to happen next month or 1 year time or 5 years time. But from our experience of the technology that went into vaccine preparation from way back, the BCG vaccine, the polio vaccine, the measles, mumps, and rubella vaccines, the technology, they are safe, and we do not anticipate that they are going to cause long-term effects. So again, I see the job, and they're doing it pretty well. Now, in other parts of the world, they have seen more severe cases of nerve involvement, Bell's palsy, and a condition called transverse myelitis. And in other parts of the world, deaths have been reported. Now, some data that are very important for us at this time, coming from the CDC, and for the unvaccinated person, you're at 6 times greater risk of testing positive for the COVID-19. You're 29 times more likely to be hospitalized than the person who is vaccinated. And you are 11.3 times at a greater risk of dying from the coronavirus if you are unvaccinated. So it brings me to the medical management, which we have been focusing on over the past 3 months. And we believe that in addition to the vaccine, treatment is also going to be very, very important, because as we mentioned before, the vaccines, even though they protect you, they give you a less severe infection, we do see cases of severe infections that will need some treatment. And so this is where our early treatment guideline we are recommending, because it works. We have seen it in our offices. It works, and I would like to briefly summarize what we are doing there. So if you look at the algorithm that I've been using over the past 3 months, you can follow carefully. And we define early as the first 6 to 7 days. We want to catch you during this period. Now, remember, as I said before, when your symptoms start on day 1, say today you have a headache or a stuffy nose, remember that you have contracted the virus 1 to 14 days prior. In my practice in Clarendon, most of the cases are seen are about 7 to 8 days, that we call it the incubation period on an average. So it means that if your symptoms start today, if you cast back your mind 6 to 8 days prior, you may find out where you contracted the virus. Now, what is happening in the early stages is that the virus is multiplying when it enters your nose, your mouth, or your eyes. It is multiplying, and by multiplying, it is causing inflammation or soreness to your body or to your body organs. So the aim in the first 6 days, we want to reduce the viral load, and we want to decrease the amount of inflammation that you are getting. Now, very, very important, we realize, and I'm seeing it more and more, that the asthmatics don't do well, the diabetics don't do well, patients with kidney disease do not do well, the obese patients do not do well. So we try to do a quick fix in this of your comorbid conditions. We try to correct your blood pressure, we try to correct your diabetes, we try to make sure your asthma is under control. It's challenging to get you down to the ideal weight to fall into the category of not getting the infection, but we try our best to address your obesity. But you understand what we're doing here. We're trying to make you fitter to fight this virus, because there's no way you can fight this virus unless you are fit. And one of the ways is that we have to correct your chronic comorbid medical conditions for you to become fitter to fight off this virus. Now, we decrease the viral load. Dr. Hunter mentioned the non-pharmacological things that we do, the menthol steaming. We address your fluid. Many patients come to us, they are dehydrated, so we address your fluid intake. We try to calculate how much fluid you would need to keep you properly hydrated. We start to teach you exercises that you can do to help your breathing, improve your outlook. And also, we have to do a lot of counseling. Over the past month of September, many patients, they come in sad, they come depressed, they are about to give up. So we literally have to speak back life into them. So a lot of counseling have to go on during this period to try to motivate them to get better. So these are some of the non-pharmacological things that we use in the first 6 days to try to make you fitter, make you better, so you can fight this infection better. Now, the other things that we do, we try to treat the virus. Now, and this is where we would recommend the antiviral medications if you can afford it. We recommend the remdesivir, we recommend the monoclonal antibodies, of which you have different types available. Most people here in Jamaica cannot afford that. We're looking at over approximately 200,000 Jamaican dollars. So in my practice, because there is inflammation in the first 6 days, because there is increase in viral load, I tend to use a medication in the form of ivermectin, which has the properties of being an anti-inflammatory agent, and it is also an antiviral. So I want you to understand why we recommend this drug at this point in our management. And simple, we use your body weight, 0.3 milligrams per kilogram. That we do as a calculation. Dr. James mentioned that it has become routine to use one single dose, but we calculate it out in MAPEN, and we give you in 2 doses, 1 dose today, and the second dose we give you 2 days after. And what we find is that it does work to reduce the inflammation. By inflammation, we're talking about soreness to your organs. It does help to reduce that, and it does help to reduce the viral load. But we put it to you, if you can afford the expensive ones like the remdesivir and the monoclonal, then that would be the ideal time to give these medication. Now, let me hasten to say to this audience that when it comes on to the management or the medical treatment of the coronavirus infection, there is no one magic medication to do that. And what am I saying this at this point? Because for us to be able to treat this infection properly, we have to have a clear understanding of the infection process. And I believe one of the things that happened to me by contracting this infection in February of this year, I was able to pinpoint and did my own research afterwards. And I tried to look at my symptoms and the treatment that was available to me. And I realized that it is a process. Now, the process is that if you go untreated in the first 6 days that I've just defined here for you, then the outcome going into the second week of your infection seem to be more worse, and the symptoms get more severe. In other words, as the virus multiplies, it is causing more inflammation or more soreness to your organs. Your lung gets sore, your liver gets sore, your gastrointestinal tract gets sore, your heart gets sore, your blood vessels also get sore. And if you go untreated in the first 6 days, your outcome in the second week, this is where the problems start to arise, because now we're not only have to tackle the virus that is multiplying, but we have to tackle now your organs, which are starting to get damaged. And so that's why we cannot overemphasize on these conferences and these presentations that early treatment is important. If you do not get the early treatment we're defining there, then you're going to have more organ damage, and your outcome, especially if you have comorbid medical conditions, existing medical conditions, your condition is going to get worse as night as day. You are going to get worse. This is what we're seeing in our clinical practice, and this is why we have come up with this guideline that no one medication can knock this thing out, but we take it in stages and we treat you in stages, and your outcome is going to be very good. So going back to the first 6 days, we having done all of this here and given you some mild anti-inflammatory, including Panadol tablets and the ivermectin or these antivirals I mentioned, we send you home and we monitor you in the comfort and the confines of your home. Many people love their home. They don't want to go to the hospital. So in your home, what we do, it's simple. We have your numbers, you have our number. We use the various social medias that are available to communicate with you. And when we ask you to come back to us at a certain time, we expect you to come, because this is a time we know that your symptoms can get worse. Things can make a change. We do not know who is going to convert into a more severe illness. And so when we say to you, come back to our office for a review, we expect that you're going to come to us. We expect you to report to us, and so we can monitor you. This is how we monitor you, to make sure that you're not getting worse, and so we can properly treat you so your outcome is good and you don't have to end up in the hospital. As mentioned before, we use a pulse oximeter to help guide us. If your oxygen level is going low, that's an indication that you're getting worse. If you tell us that your symptoms are getting worse, then we will quickly address those issues. Now, we routinely bring back in my practice in Maypen everybody at day 7 to day 8, because this is the time I mentioned that if you're going to get worse, it's going to start showing up at this stage. So if you come and we assess you and you're getting worse, then 2 things are happening that we mentioned them before. The inflammation cause a lot of fluid production. And so these fluids harden and they form thick mucus plugs. And so that's one thing that we have to deal with. So we include the physiotherapist at this stage. Then also the soreness of your organs lead to hemorrhage, bleeding. So you have clots formation, which we have to contend with at this time. So during the second week, if you're getting worse, we have medications available in private practice in the form of steroids, dexamethasone or prednisone. And we also administer blood thinners based on our understanding of the infection process. And we find that when we give you these medications at this stage, usually within 4 days, 3 to 4 days, your symptoms improve dramatically. So we do have medication to monitor you as an outpatient, and we give you the medications again, and we send you back home, and you report to us, and we monitor you again. And then if you're getting worse, meaning that your oxygen level is falling below 93%, as is recommended by the Ministry of Health and Works here, we do recommend that you get hospitalized treatment, because you may need more intense therapy, maybe perhaps oxygen therapy. We have managed quite a few patients at home with oxygen and fluids, and they do well without having to go into the hospital. Now, when we practice like this, we find that the outcome is very good. Most people recovered during the second week of the infection, and thereafter we see you back in the third week. We make sure that you're well, we counsel you, we continue to do our testing, we continue to rehabilitate you, we continue to look at your energy levels and get you prepared again to go back to your family life or your workplace to make you productive again. When we treat like this early, what I'm finding out, nobody has complained of long COVID symptoms that affect the heart, the lung, the kidney. We find there's little or no of that to report on in my practice in Maypen, but this comes because we treat you very early. Some of the challenges that we face is that if you do not come back to us at the time we say come back for review, some people panic, they get worse, and they go to the hospital because they're getting worse, and so they get treatment at the hospital. But if you do follow our guidelines and our recommendations that we make with regards to when to visit us, when to tell us if you're getting worse, then we find that there is less hospitalization and less death. So this is in summary of what the early treatment is all about. If you start treating from day one of your symptom, we see you during that week, we diagnose you, we make sure that you have it, and then we initiate the treatment. We hit really hard in the first 6 days. And then most people from my practice get better. They don't need any form of intervention in the second week, more than just to continue monitoring them. But we have seen cases that convert into a more severe illness, even patients with multiple comorbid conditions, and we see them improving during the second week of treatment. So the conclusion is that early treatment does work. Early treatment will prevent hospitalization. Early treatment will prevent the need for oxygen. Early treatment will prevent long COVID symptoms, and indeed, early treatment will prevent deaths. So I would like to pause here at this time, Dr. Hunter, and I will hand over back to you to continue the discussions.
Thank you, Leroy. Excellent presentation as always. Certainly is now loaded with a lot more experience, a lot more experiential learning and experience sharing. Can you stop sharing your screen for a bit to allow us to have a quick chat and then?
Okay, yes.
Good, yes, so early treatment. So you are seeing in your practice numbers declining?
Yes, significantly. Since the month of October, I've seen a significant fall in the amount of cases. I can maybe count on one hand. For the past 2 weeks, the amount of cases I'm seeing, I was overwhelmed in August and September, but now we are seeing a significant fall off. Many families have gotten better. And yes, we have to give thanks for that.
I want to just emphasize that we don't like to see patients sick. We're here, yes, we're trained to treat the ill, but we much rather having a discussion with you around wellness rather than, isn't it?
Right, perfect, yes.
Yes, right. Yes, and we have seen, I myself, I mean, I've we've come from a point of view where I was getting 250 WhatsApp messages every hour, right through the night. We've had to be sending the algorithm out. And I think there are different elements in terms of what have contributed to the fall in the deaths, but certainly early home-based treatment, early intervention, I think that's certainly the key. I've had several people contact us from within the hospitals for algorithms to share with them in the hospital how to treat early. And it's just
Yeah,
amazing.
it has worked, and we have seen the rewards here in Clarendon. We do see less patients getting ill. I mean, we're going now to the end of the third wave, as I defined earlier, but yes, we're really happy when we see it like this. Our text lines are getting less. We're not bombarded with a lot of messages and calls again, and people are happy. This is a happy time actually, because they're coming back 1 month after their infection, and I'm able to see that most of them do not show any signs yet of any long COVID symptoms. So it's really rewarding to know that they were treated early, and some of the things that were happening worldwide because patients were asked to stay at home and watch it, and then the amount of damage, organ damage that was taking place now, because we have changed that, our patients are benefiting and we're seeing less of the long COVID. So this is the happy hour, the happy time when we're seeing dramatic improvement in their physical status.
So with early home-based treatment, a lot of people have now gotten better from COVID and have developed natural immunity.
All right, that is correct. That is correct, yes.
So despite being unvaccinated, we're seeing a lot of people now develop immune competence, immune memory, immune intelligence that they know now, and they're not going to be dying from COVID within the next year.
Right, that is true, but I'd just like to mention here, Dr. Hunter, that most of the studies there are quite a few studies out also that depending on the severity of your infection, your antibody level might be falling off. And so there's a recommendation out there that at some point in time, you definitely will need vaccines to boost up your antibody count to keep you protected for a long, long time. As a matter of fact, I am considered as a super protector right now, because I am told that having such a moderate to severe infection and then taking the Pfizer vaccine, that my immune system is supposed to be super protected, or I'm super protected. So I will see how long that will last, but for the sake of the audience, yes, I got the infection and I got my 2 jabs of the Pfizer vaccine.
And you have no complications from the Pfizer?
I have no complications, no.
Oh, that's amazing. What is also true, though, is that the immune system is not just about antibodies, is it? Isn't it also about the killer T cells? And
the killer T cells, yes.
Cells which we really don't measure when we test antibody levels, do we?
Say that again?
When we're testing antibody levels, we're not measuring the killer T cells.
No, it's just the antibody, count we're measuring, yes.
The T cell arm of the immune system is still quite evident within those who have survived, even though we're not able to measure it. It's still quite active, isn't it?
Right, definitely.
Absolutely. Well, Leroy, for the interest of time, we have to move on. Lovely. We'll come back at you again at the end. Please stick around. We're going to go and take some testimonials now. And we'll start by taking a testimonial from Mr. Lacine. Is Lacine here? And Andre, his son. I mean, I can tell you this was to me one of the most difficult periods for me, treating with COVID. So we'd like to hear from Lacine. Lacine, I'm going to ask you to unmute yourself. Hold on, let me make you a co-host for this purpose. Hold on. Here you go, Lacine. I'm gonna make you co-host, right? Yes, so you can go ahead and unmute yourself. So there you go. Okay, you should be able to unmute now. Are you unmuting, Lacine? Oh yeah, great. Yes. All right. So good night. Yes, hello, I see everybody there. I'm seeing Lacine and I'm seeing Andre. Nikki, hi everybody to the world, to YouTube space out there that we're seeing you. tell us why should we listen to what you're telling us? Tell us how you're feeling. Tell us what happened. Tell us about your journey with COVID. Good to see you. It is wonderful to see you. So
Yeah.
start, talk, as I say in Jamaica, talk the thing.
All right. So for us, we are living testimony that early treatment matters. You hearing me?
Yes, loud and clear.
Hello?
Go ahead. We're hearing you
Yeah.
loud.
We're a living testimony that early treatment does matters, and everything that was spoken from the start until now, it is, I can testify that you're 100% correct. Seeing that my father was extremely ill, like he was next to being dead, to be blunt. So yeah. So early treatment does matter.
Did he pass out? Did he collapse?
Yeah.
Yes, I passed out for like 3 hours roughly.
Yeah, you didn't know yourself.
Didn't know myself for about 3 hours.
Lockjaw. So.
Lockjaw was coming into play, you know, and all of those stuff. But one thing I know for sure, steaming does work. I mean, it really cleared the airways. It's really good. Trust me.
Absolutely.
Right.
And one of the things that kept us so busy with you was the whole business that you were also breathing heavily and you're dehydrated. You're
Yeah, for sure. Very much so. And that was it to be.
Yeah. You were saying something, Stock?
Tell us what happened. Where did you seek attention first? What was your journey like before you came to me?
I seek attention at other hospitals. Wasn't getting anywhere, you know. Wasn't getting anywhere.
Yeah, and like you said, like
Are you waiting in the dirt somewhere or something like that? You mentioned, maybe I'm wrong. Forgive me.
Yeah. So like you said, we went to other doctors and they told us that, you know, his sinus was draining.
And then,
But at the end of the day, it was COVID. So yeah, everything
we
did the test, it was positive. Like you guys were saying earlier.
Yeah, and I mean, you know, I heard about you through a good friend of mine. Yeah, and you know, that's where I made the link up with you. But
So you
I
were
cannot.
waiting on that tent somewhere. The tent
Yes,
was.
I was waiting in that tent at a hospital, you know, not reaching anywhere, as a matter of fact, you know.
At a permanent hospital.
Permanent one too. And then that's when I call my friend and say, I'm here, I'm dying, I need help, please. And that's how, you know, he gave me your number.
And the hospital promised to call you back?
They promised to call me back. Until now, I don't get that call while they're waiting. So eventually, I was to leave.
Right. I mean, when I saw you, it was obvious that you were in distress. You were tired. We had to see it.
I was dying. Yeah.
I mean, you really worked it. I mean, I couldn't leave you. I had to stay 14 hours at your side.
Yes,
for sure.
For sure. And man, sometimes I wonder where you're going to find that. I mean, that was great. I cannot stop thanking you, man. Telling you.
How severe it had become. It's like, say, well, if you're treating a home environment, or you're just treating the mild and moderate cases, but not severe. I don't know what is severe.
The lockjaw came into place. You corrected it. I mean, I was unconscious for like 3 hours or more. Yeah, you understand me? Oxygen level.
Oxygen level was below 90 at one point.
It was like at 81 at one point.
Yeah.
And did you feel distant, or were you felt like in a lonely space, or you felt people were around you who were there with you?
Well, I was very happy. You in particular, my son Nicky. I mean, you were there for me right from the start until the end.
And the fact that your family, your dear son, his amazing partner, girlfriend Nikki, were there, and it's now gone a month, and they're not sick from COVID still, and they were there right there with you during your illness. How did that make you feel? Seeing your loved ones right there, right through your illness. They weren't run away or sent away. How did that make you feel? To have your loved ones right there. To have
Yeah, man.
right there, to have Nikki right there.
Yeah, they were holding me. I mean, helping me a lot. They did not be, they were not afraid to touch me, you know?
Andre.
And that gave me that extra boost, trust me.
And Andre, speaking from your side, because you know, you see dad, he collapsed, was passed out. We had to drive him up to, it was so crazy. But
yeah,
dad, were you afraid for your own safety that your dad has COVID and you might die from COVID?
No, to be honest, I was more focused on him getting better and all of that, more than myself at the moment in time. You know?
And you kind of had a feeling that if you should get sick, well, you kind of knew somebody who could help you with that anyway.
Yeah, so I had a lot of confidence, so that was no problem, you know?
And did we wear space suits and, you know?
No mask. No mask. We were not wearing anything. Yeah. Because when I saw you guys, I was like, why you guys are not in mask and stuff, you know?
PPE, that's what they call it, PPE.
Yeah.
So what this really teaches us that there are different approaches to managing a particular condition. And it's very important that we all views contend, all approaches contend. That it can't, if you only have a vaccine, if we're to vaccinate you and expect that that will be enough, well, people are going to die.
Yeah, that's sure.
Die.
I believe so.
But if you're dehydrated,
you
need 7 liters of fluid and you don't correct that dehydration, then
yeah, for sure. All right, for everything that you guys put in place, it is absolutely necessary. So I'll advise anyone out there, you know, if you haven't had experience yet,
you're breaking up a bit, but I think we're hearing what you're saying, that the
as yet, or to take every information literally.
Right. And in terms of the algorithm, the treatment, yeah, you're back again. I'm hearing you again. Go ahead. You wanna do a second take on what you just said? I think your connection you're frozen a bit. Do you want to try again? So Mr. Farquharson had a very severe condition here. He was very dehydrated. And, you know, if you say COVID is a magic bullet, as my colleague, Dr. Leroy Heyman tells us, it's not a magic bullet. There's no magic bullet for COVID. People have diabetes out of control, blood pressure that's out of control. People get renal failure, liver failure, so many things that will need to be corrected. So you have to be aware of all the things that are operating and then, you know, address that. You're back again with us. Go ahead, Lassine or Andre. I think you're muted. Let me ask you to unmute. Go ahead and unmute.
Yes.
Go ahead. Yes.
All right. One thing for sure, early treatment matters. To get early treatment is the best thing to do.
Yes.
For sure. Because the COVID I had, it was in a deteriorating state, you know, because I was at home. I was kind of watching for like 14 days, you know, quarantine. It doesn't work.
It was a late stage presentation. Watching something and doing nothing is not a good idea, is it?
Not at all. You have to make some kind of step forward, you know, just like it. Just like to get
go to the hospital. You did go to the hospital and they put you in a tent where there's dirt.
Yeah, kind of dusty. Dust bowl. It was outside, you know.
It was outside on a dirt area. There was no concrete, no nothing. So, but it didn't call you back. So this is the experience not only unique to you, but several other people. And where is the conversation about treatment early?
Yeah. I think this is something that should be pushed. You know, so we can fight this COVID thing from early, and then we'll see greater results.
And tell me, what about your own metabolic state of health now? Now that you have survived COVID, you're now a COVID champion. What are you gonna do to further insulate, to make your body fit for the next wave of COVID in a year or more from now? What are you gonna do? You're gonna do some weight loss? Tell me about it.
Yeah, we'll start to steam. We're going to steam more often, stay hydrated, you know, focus more on our diets and all of that.
And exercise.
The breathing exercises and all of that. Yeah.
Excellent.
And taking our vitamin C and all of those stuff, you know, to get the
yes.
the
And
immune
to talk about our health more, you know, to just share with each other, talk about how you're feeling today, not just, you know, I'm all right, I just still ache.
Tell them how you feel.
I'm feeling good now.
Yeah, at one point, you know, he was struggling to walk. Yeah, you know.
Right.
So
Yeah, man.
and every morning he's up, you know, doing his exercise
exercising and-
routine and so forth. So
And he's back at work, although in a controlled
Yeah.
way, not working
yeah,
100.
man, for sure.
I'm back at work 2 weeks now.
Excellent,
Yeah.
excellent. And a CT scan that showed some residue inflammation, a little pockets of
Yeah,
inflammation,
we did that.
but no blood clots in the lung.
No.
Excellent.
no.
Brother Lassine and Andre and Nikki, thank you so much for enhancing, contributing here tonight. I'm sure people have heard your journey is not unique. A lot of people sadly have passed, have gone further down that road and sadly died. But I think you went as close to death as possible and still came back. But what's amazing is that you're able to do so without oxygen as well. So
Yeah,
that's
no oxygen, 0% oxygen. Yeah.
excellent.
And thank you for having us. And I hope everyone that is listening take heed to your words and apply them to others, you know, family members, friends, or whoever the associate, whoever those persons are. I'm asking you guys to take this serious because it actually works without a doubt. And you can be a testimony as well, seeing that we're already past that phase and so forth. So yeah.
Thank you. I myself have lost 20 pounds from April to now, and I've kept it down. My glasses sometimes falls off me now because it's not my size.
Yeah.
Excellent. Thank you. Thank you so much. Well, stick around in case anybody wants to ask you any questions later. But I'm gonna move on to Nicholas. Nicholas, are you there? I want you to unmute. I'm gonna go into Nicholas here and find Nicholas as a testimonial. Nick, I'm gonna make you a co-host. Nick, and then we'll get Yannick as well too. So I'm gonna ask you to unmute, Nick. Nick, can you go ahead and unmute? I'm gonna make you a co-host. Hi, yeah.
Hello.
Go ahead, Nick. We're here.
Yeah. My testimony now. I remember when I contracted COVID, and I got tested. I think it on a particular day, and I found that I was positive, and I contacted my GP, and because I was supposed to go to the doctor for other occasion, and I didn't want to wait at that time to tell him, so I called him immediately and let him know. And he said to me that, all right, just do your 14 days and come back and check me. I'm say just like that. And I'm say I'll tell him that I bought some Panadol and I was taking those. I'm say, yeah man, just do your 14 days and when you finish, you come back and check. And I was saying no, because I was having diarrhea, I was having roasting fever, and my temperature was increasing. I was trying to take the Panadol along with some bush tea like fever grass, and it was just dropping my temperature by like 1 degree. And in the nighttime, I was sweating. My bed was wet. It was like a pool. I had 3 pillars around me, and all the pillars were wet. It's like somebody was throwing water on me. And I know I was dehydrating because I could see it in my eyes. And from the diarrhea as well. I had the diarrhea almost for a week. And I remember my sister, Yannick, she was mentioning to me that she was keep on coming and checking up on me because she was the only one that was there giving me the support. And I remember she came, I think it was on a Friday.
Yes.
That will be about the 7th day. And she was saying to me, because I wasn't talking to anybody much, I was basically on my phone texting most of the people. And I was speaking to her, and she said, Nick, we're talking like that because I have this jitter when I'm talking. And I was saying, something like this happened to me before when I had an infection on my chest. So I was saying, maybe is it coming on me again? And she was, no, you haven't shot a breath. And then she did breaths per second, something like that. She did a count on me. I realized that I was really breathing short. And she had your number, Dr. Hunt, from her husband. And she said she would give her a call and explain what's happened to me. And she mentioned that my oxygen level had fallen off in the low 80s, in the late 70s as well. And you said to her that let him come see me right now. You understand? And that's how we end up seeing her in the night, about 9 o'clock in the night. And you went ahead with the mental crystal steaming. And you tried the steaming with me first. And you start seeing improvement. You start seeing my oxygen level going up, but it was going up and going down. And it was saying, come on, you need to cough up some of that mucus. And that mucus that came up was really thick. I always hear people say the mucus thick like glue, but it actually is like that. Because I remember when I first saw the mucus and I actually spit it out in the sink, and it was like the mucus just stand up and not moving. I was like, no, I turned on the water and it not moving. That's how thick it was. And I was saying, whoa, this is actually sitting on your chest, killing you. You understand? And yeah, and you did the treatment on me as well, and you gave me a lot of medication. Some of them I don't remember. Ivermectin, and you gave me the
remdesivir, right? Intravenous
remdesivir treatment as well. You had some Cutting-X as well. That's the blood thinners.
Nox, right? Clexane, heparin.
Yeah. And
IV levofloxacin antibiotics. We gave you IV dexamethasone, which was shown to be of good effect in this condition from over a year ago, as well as ivermectin. And so it's a combination of strategies, as well as 3 liters. You got over 3 liters of fluid rehydration, and of course steam. That was
because I was really shocked when you told me that actually took 5 bags of IV, because I said 5 bags. That, I mean, it's not. I didn't expect that was so much. But
right.
Yeah.
Once you got you stabilized, it was just all up. Looking
yeah,
up.
because every day I start seeing improvement from I start taking the medication, because I wasn't eating, none at all, no taste. My appetite was gone totally. I just wanted to drink just like juice, and even the water tastes bad to me.
Right.
And I felt weak, but it's more like I just don't have the energy to get up. But I could get up and do stuff for myself. But I will see my phone over there and don't even want to go for it.
Absolutely.
You understand? So, but every day, was an improvement for me. I started getting back my taste. I started eating more little by little. I lost about roughly 15 pounds weight loss. And yeah, every day it was just improvement going on right up. My breathing, I think up to the 14th day, I had to be off work for another 5 days because my breathing was still short. And after that extra 5 days, continuing on the medication, that shortness subsided.
Wonderful.
And I still have a bit of drainage, it's a sinus issue, but I still do my steaming. I'm not doing it so often, like 4 times. I'm doing like in the morning and in the evening. But
Right.
I know you recommend the 10 pieces of mental crystal,
as well.
but no, because my nasal passage is clear now.
Can cut it
I'm
off.
using like a small piece now, just with the water.
Because it can
Actually, yeah. But
excellent.
yeah, I'm pretty much well. I'm pretty much fine. I'm back.
What about metabolic? What about your metabolic basal health now? To weight loss, the little tummy there, the belt. You know, how are we doing in that?
Well, I just realized that that I just gained back like 2 pounds, but it's just been maintaining there ever since. My metabolic rate has increased. I don't know if it's from COVID as well. But I realized my weight is staying down. It's not coming back on.
Excellent. So I want to keep it in the safe zone. And we know you're a little bit overweight, right?
Yes. I'm drinking a lot of water. I continue drinking a lot of water just the same. Keeping off the sugary stuff. You know, just to maintain that weight as well.
What about the blood pressure machine? You bought one? Are you cholesterol?
Yeah, I have a blood pressure machine because I'm hypertensive as well. So I have to keep monitoring it as well. But my blood pressure is stable. It's not high. It's in the normal because I take medication for it as well.
Once you lose weight, you find that the blood pressure should fall even further.
Yeah.
Excellent. I want to hear from your sister now, Nick, because your sister is a consultant pediatrician or consultant pediatric physician. And it would be nice to hear because she was your support. So I want to hear
definitely.
Unique, from her lens, from her perspective, how this worked for her. So I'm going to ask her to unmute and make her co-host. Unique, Dr. Brown. Welcome.
Hi, good night, everyone.
Good night.
Good night, everyone. As he mentioned, my name is Dr. Yannick Brown. I'm a consultant pediatrician, and I'm truly grateful for your help, Dr. Hunter. With my brother, he told his story, right? And if it wasn't for the help that you gave him, I don't think probably he wouldn't be alive today. So we're truly grateful. As mentioned, he had gone on quarantine. There was a co-worker who had contracted COVID. And so he went on quarantine the Thursday, and then by the Saturday, he started having symptoms, which he had explained, fever, chills, and then cough, diarrhea, and tested positive on the Monday. I'd encourage him to follow your protocol. I learned about your protocol from participating in one of your conferences. Actually got the link from my husband, and also I saw someone advertise it on WhatsApp. So I shared it with him and encouraged him to stick with the protocol where, try to steam, take the vitamins. In fact, he used to take the vitamins before. That's the vitamin D, the calcium. He actually took, in the past, he had developed kidney stones, and this was because he was taking vitamin D along with calcium, because he had thought sometime in the past that he was developing COVID, but at that time that wasn't the case. So he came off those completely. But then when he found out that he was COVID positive again, he started his vitamin D and C, along with the zinc, and of course drinking a lot of fluids, warm fluids. He drank his ginger tea, his turmeric tea, and he tried to steam. But the way he was steaming, I think it was pretty too short. When he met you taught us how to steam for an hour, and taking deep breaths, right? So at the time he was steaming with eucalyptus, but it was just for like 10 minutes and twice a day. During that time, his oxygen level was 95 to 96. But by the Wednesday, his oxygen level started falling to 92. And then the fever wasn't breaking. So I was saying, you know, probably he has a bacterial infection as well. So I'd started him on Zinat and Zitromax from your protocol and the ivermectin. But the fever persisted. And as he mentioned, by the Friday, I noticed that, you know, when he's, you know, observing him, that he was, you know, having shortness of breath. And so I actually went in and examined him. Of course, I put on my mask and my gown and everything. And when I listened to his chest, it was wet, you know, what we call crepes. You know, it was, his chest was wet. He was still having a fever. And so I was really concerned, you know, that, you know, and then his oxygen level went really low. As he had mentioned, it was 90. I tried him on some Ventolin, and then it dropped to 70, then came up to 85, and then back to 90. So that was kind of scary for me. So I contacted you. As he mentioned, my husband had your number, plus your number was also on the algorithm that you sent out. And so I called you, and as he said, that you said to come right away, and that's what we did.
Yes,
And
that was like a Friday night, isn't it? When we were looking to coming in from Mandeville one night. It was horrible to think that we can't go to bed as yet. It's horrible.
And I really appreciate that, you know, because how many doctors would be willing to do something like that, right?
No, when we saw him, he would have been, I think by the time we left him for the morning, he would have been dead. It was really getting into that thrombotic phase, going into clotting off, and no oxygen would help.
So yes, you started steaming him right away. And
what
as
oxygen saturation, what did you witness to the oxygen saturation? What you saw for your
it gradually increased. It was the more he steamed and the more he took deeper breaths, you see it gradually increased. There was a point where it went all the way up to 99%, and then as soon as he stopped, it fell back down. And then you encouraged us to keep on steaming, and then he got physiotherapy as well, which also helped. And then you had given him IV fluids because he was a bit dehydrated as well.
That's right.
And then the different medications, you gave him IV antibiotics, you know, well, Zocin or Truvesta, the Levoflox.
Ashers-P, Ashers-P.
And the Remdesivir. You gave him some more ivermectin. I mean, he had gotten a dose in the evening, but you gave him some more because I was giving him the low dose of ivermectin. You started him on the blood thinners, which he had mentioned, the Clexane, and the steroids, the dexamethasone. You also gave him that, and it actually, the fever broke as soon as he had gotten the different treatment. The fever broke. It just did not come back.
Excellent, and he just got better. So, what you thought about our approach, having survived COVID and not wearing masks and not wearing PPEs, as working within the system?
No, I was just in shock because I mean, even though you're saying, you know, this is something you do, but you know, I still continue to wear my mask because, you know, I just think that's still the best thing to do, right? But
to conduct an experiment on me, and I'm still alive.
Yeah, I realize you're still okay, but I mean, I still would prefer to.
I would have had COVID right by then. Within 21 days, I would have gotten COVID by then. How comes? Why not? It means that my natural immunity is not working. My T cells are sleeping. Every time I treat a COVID patient, is every time I'm getting memory of that particular agent. So it's every time I have a chance to be stimulated again, it's like I'm getting my booster, but I'm doing it according to how Onesimus taught us to do it. And you know, but the thing is the humanity. I mean, how do you feel to be treated at a distance, alone by yourself? How do you feel as a child, as an elderly patient, or anybody to be treated with that distant
Mhm.
fearful trepidation around you, I don't think it helps you to get better. We are treated at distance.
Yeah, I agree with you. I mean, because I can see that he also was he was feeling down because he was alone.
Okay.
So I mean, I stayed with him. I even took 2 days off from work and assisted him as much as possible. And you could see a difference. I mean, in in his face, he didn't. I think he was probably a little depressed, and then you could see a difference. I mean, just having somebody right there, it certainly
Yes.
made a difference.
Yeah,
And
absolutely.
and I must say, I'm happy I took him to you because I was a bit scared. A lot of the hospitals are full with patients, and the shortage of oxygen.
Oh, how much
So
oxygen did we use?
you didn't use any oxygen at all, not at no oxygen, and his oxygen level went up just with steaming.
Amazing.
So
And kept that way when he went home 12 hours later, or
yeah, and when he went home, he continued to steam up to 5 times a day, and just as how you taught him to do it straight for an hour, taking deep breaths. He tried to do his own little physio by blowing balloons,
excellent. Yes,
right?
that's very good.
And I mean, and then you sent him home on different antibiotics, the clindamycin, the levoflox, the doxycycline, for him to get another dose of the ivermectin. He went home on the Montelukast.
Yes.
So we know that's an antihistamine combined with a leukotriene inhibitor, because with COVID, the cytokine storm, there are a lot of inflammatory mediators, so that's where that comes in to dampen down all that inflammatory mediators. He took his blood thinners, that is the Clexane and then the Xarelto. He had to take Cataflam for his fever, and he continued on the dexamethasone. And you gave him something to protect the stomach, that's the Pantecta from the steroid. And we know sometimes when you're on steroids, they can develop a fungal infection. So you gave him antifungals as well.
Right. In
And
fact, in India, they had a big problem with the black fungus, the aspergillosis from the
yes,
diabetic on the fungus. So I didn't want, maybe he was pre-diabetic. They wanted to take a chance. So.
and
Sorry.
of course, to continue his vitamins, he took his vitamin D, C, zinc. He got his sun therapy, which he had encouraged, and just drinking a lot of fluids, warm fluids, and the oral mouth care. He did that as well, because he did emphasize that where after eating to floss, brush your teeth, and gargle with Listerine, which he did. And he gradually improved, where his oxygen level went up to 95, then 96, as he had said. By I think about 4 days later, I wasn't hearing any more wetness in his chest, right? But he still had a little shortness of breath if he spoke too long. So I think, as he mentioned, probably after about two weeks or so, that was pretty much gone. So it shows that the early home-based treatment really works. I mean, even when I'd looked at your different conferences on YouTube, I shared it with others as well, other doctors that work in the WhatsApp group, right? And I remember even another co-worker, his father had gotten sick, but he did mention he was encouraging his father to steam as well. So it really works. It really works.
And what would be nice is if everybody could come together around the table and to share experiences. And everybody, I mean, the government arm of healthcare should come together and look and sit with the independent public health practitioners. It's not only about getting the private doctors to give vaccines. What about learning from the approaches such as steaming, oral hygiene, hydration at the community level? How can that be practiced in the hospital? Because I get the impression that they don't steam in the government hospital. Is that right?
Right. I mean, where I am at the hospital, I mean, I work mainly with children, but newborns, right? at a maternity hospital, right? So, but I don't see where steaming is practiced there.
Absolutely. I mean,
and I think it would be very important because I've seen where the oxygen level can go up with just with steaming and without oxygen. So
because
I
he was
mean, I've
constantly
spoken
monitored,
to other
wasn't he?
persons.
Objective
Pardon?
monitoring. He was under objective monitoring whilst he
Yes,
was in steam. So it's not like we're guessing to see if it immediately responded to the oxygen levels went right up the minute we put steaming in.
yes,
So he had an objective measure.
yes, I saw that. I saw that. As I said before, I saw where it even went up to 99%, but as soon as it stopped, as soon as he stopped steaming, it went back down. So we just kept on steaming him.
Right. And you have to steam not for 15 minutes, for like an hour, and do it in a sustainable way, combine it with hydration, and then cough and percuss, and then clear the airway. And once you clear the airway, it then stabilizes in the 90s and go. Certainly that was my experience from me, the patient, when my SAT was 79%. I steamed, coughed up a plug of yellow stuff, and then it just kept into the 90s without any oxygen. I didn't use oxygen either for myself.
Yes. So Dr. Hunter, we really appreciate the assistance that we got from you. It just shows again that this early home-based treatment for COVID really works. And I'm happy that you're getting the word out there through these conferences.
I really want, I know I'm grateful for these conferences, and everybody who attends these conferences need to be champions. I need to go out and tell and say, yes, you don't necessarily have to rely only on oxygen. How is it that another approach can yield results? How is it people not wearing spacesuits and PPEs can still survive and treat others? And how comes? Why not look at different approaches? It cannot be that we have people dying who are fully vaccinated and your only approach is to vaccinate, or to tell people to wait for 2 weeks, watch yourself for 2 weeks, and when you're really, really sick, come back to us. It cannot be. It must be another way.
Yeah, totally agree. I totally agree. And it just shows, because I mean, for his GP to tell him to come back in 14 days, it just shows there are a lot of even doctors out there who aren't probably not properly educated or don't have enough experience with this. And I do encourage you to continue with this forum. I mean, hopefully we'll get there to them as well. And I guess even for me, I can continue doing my part in sharing the information with others as well.
Absolutely. I'm so grateful. I mean, to be honest, it's a privilege and an honor to treat anybody, and certainly my colleagues, to be able to treat your loved one is certainly a privilege and an honor. Having your objective lens to scrutinize what we're doing is important as well, because you wrote down everything and you're very detailed. And so that provided you with a substantial basis to examine what happened. You can look back and say, well, did this work? Did that work? And so we're very, very grateful for that. And we're very happy to have met you properly through that forum and to see how amazing Nicholas is. I think by now his wife should have come back. Is she back?
Yeah, she's here.
He was certainly alone at the time. And it's just amazing and wonderful thing. So thank you tonight for what you have shared with us. And thank you for being there for our champion going forward, and to see what best practices you can extract from here. And it's a difficult thing to try and convince a system that they could perhaps change. But through one person, one experience at a time, we can change the world. And so I think that's the approach we'll have to do, rather than shouting at people and telling people, is you caused this or you caused that. We'll just do it one case at a time.
Yeah, totally agree. And thank you for allowing us to give our testimonial. All right, thank you.
Thank you again. All right, thank you. Okay, I think is there anybody else who had a testimony to give tonight? You can raise your hands. I think we're expecting a few more people. Otherwise, if not, we will go into the question and answer. Before I do that, any of my colleagues, Dr. Heyman, do you want to add any comment at this stage? Dr. Michael James, Dr. Estor, Mr. Andre Duncan, anybody would like to make a comment based on what you've seen? You can just go ahead. No? Leroy, unmute. Don't allow us to unmute ourselves. Right. So you can go ahead and unmute. Mr. Duncan, you're still there? Leroy? Okay. No. Okay, well, it's all over to our amazing audience who stuck with us. So it's about experience sharing. So we will take the Q&As at this time, questions. Anybody who has a question, just raise your hands and we can go and we can go ahead and take your question at this stage. Just unmute yourself. Just raise your hand. No questions? No? I mean, I can tell you that we've had even another patient with acute renal failure who post-COVID, and we've had to, again, dehydrated, and we've had to actually dialyze him at home. So there's this company that's called mobile dialysis that actually brings dialysis to your home. Rather than you going into the dialysis center, they bring the dialysis machine to you. And that provides a number of advantages, including reduces your risk of transmission. Patients with renal failure have had a very, very difficult time during COVID, and several people with kidney disease have died having contracted COVID, perhaps in the dialysis suite or on the journey to go and get dialyzed. But mobile dialysis allows the dialysis machine to come to your home and for you to be dialyzed at home. And Dr. Shaibo and his crew, Jose Buchanan, want to recognize and acknowledge them for what they have done in that regard. Again, you know, we are at the stage where we can take questions. Any questions, any comments? I have allowed everyone to unmute themselves. So you can raise your hands and ask questions if you want to ask questions at this stage. Madge, do you have a question?
Night, baby.
Good night, Madge. We're hearing you.
Hey, Roger, what's up? Good night.
Hey,
yeah,
who?
Matt Foreman.
Okay, hi, Madge. Go on, tell us. Give us a question.
Yeah, what I wanted to know, really,
Where are you from, by the way? Can you locate yourself and for the rest of the people here?
Oh, I'm Matt Foreman, RN, working at the Tony Twait Swing and the endoscopy unit at the moment.
Excellent, thank you. That's at University Hospital.
Yeah.
Okay.
Yeah, what I want to know, re the AstraZeneca vaccine, is there any news on whether or not there is a booster dose available, or is there going to be one?
I think it's available. I think there are excess doses of AstraZeneca vaccines available. I think there is a hesitancy around it, but from a formal, I've not heard a formal announcement from the Ministry of Health to say, let us go and take a booster, give a booster vaccine to the population. Okay. And that makes sense because I don't think we have reached 20% fully vaccinated as yet. So I don't think they could enter into that conversation. What is also true is that a number of fully vaccinated Jamaicans have died, including at University Hospital. I mean, my uncle-in-law was buried on Monday. He had COVID, fully vaccinated. So it's not only about vaccination. And of course, the title of this conference is not about bashing vaccines, but it's about early home-based treatment, both for the vaccinated and the unvaccinated. But from a policy position, I've not heard the government articulate a position with regards to booster from whatever vaccine, be it J&J, Pfizer, or AstraZeneca vaccine. But again, I stress this conference is about early home-based intervention for the vaccinated and the unvaccinated.
Okay. Okay, thank you. But the other question is, re the treatment with the ivermectin. How expensive is it? Can it be discussed there?
Yes, we can discuss it. The price have certainly come down. Certainly in March, early this year, it wasn't readily available. So the price was very high. I think the course was as much as $80,000 back then. But the price now is like $1,000 for a 12 milligram tablet. It's much more affordable. So a course should you can get a course, a treatment course for, we take 12 milligrams a day. That's $5,000 for the day. I think that is affordable by most people's.
Okay, thank you very much. Great work. Good, good.
Great job. Nice hearing you again.
Okay, good.
All right. Anybody else want to ask a question? You can unmute yourselves. Just raise your hands. We could identify you. Just identify yourself. We'll do question Q&As for about 10 minutes. No?
I
Okay.
have my hand raised. Andrea Moore.
I want to see Andrea's hand. I'm going to try to set so I can see your hands. Andrea, welcome. Please, it's a pleasure to have you here.
Thank you
yes.
so much, Dr. Hunter. Thanks for the invitation. I have been enlightened and edified by the information provided. I'm of the view that the home remedies, in terms of the treatment, I should say, not home remedies, but home treatment, more correctly, is of great significance. I recently had the experience with my mother, who doesn't have COVID, but she had she was unwell at home, and ordinarily would have taken her to the hospital. And based on what was happening in the hospital, her doctor recommended do not come to the hospital. And they were able to come to the home and treat her, and she is back up and running, and we're just happy that she has improved in health. But just to make the comment to say how important the home treatment is, so that the hospital can accommodate persons who have other ailments and not being what should I say, not being, I want to say congested, but just to say that you have most persons who have COVID-19 that had they been encouraged to consider any symptom to get tested, so that they would have an early detection and an opportunity to be treated, and therefore they would not have to get to the stage where they need to be hospitalized. So whether it is for vaccination or on our persons who don't wish to be, then I think it is just a very important factor to be promoted, that the early treatment is the best remedy. Just like in other illnesses and cancer, etc., early detection is always best. So just wanted to commend you and the team for putting on this very important conference, and a timely one, so that we can benefit from the information. But perhaps I didn't mean to ask a question, but now that I'm at it, I'm thinking, is there an application for ivermectin to be available? I remember the chief medical officer commented that there was an application submitted, but it was incomplete or something along those lines. So they would welcome it for consideration, the government that is, but I'm not sure where that has reached. If you could share with us, if you're familiar with it, then we'd be grateful.
Well, to be honest, I'm not sure what's happening with that application. I think it was laid squarely on the shoulders of government, right in front of them. You had several doctors, physicians, organizations, civil society calling on government to make ivermectin available. We now know that they have allowed importation. I think LASCO was given that importation license. But for all intents and purposes, if you have the funds, you can get ivermectin. The difficulty though, I don't think it's available as a routine in government public hospitals. So if I'm an inpatient at Maypen, Mandeville, St. Anne's Bay, ivermectin is not part of the routine drug treatments. However, outside, it's readily available in the private sector. At your home, you can get ivermectin, just that they have not made a policy position to make it available within their institution. Of course, we're of the view that ivermectin by itself is not a magic bullet. As you heard, there are several people who came very dehydrated. So if we only give them ivermectin, then they would die. So it's about fixing everything in a holistic manner. We also recommend ivermectin, but from a policy perspective, I'm not sure if the government has approved formally ivermectin for use in COVID. But we know they have not made any attempts to stop its use, so to speak. In fact, they have allowed the importation of ivermectin, and I'm sure there are several people across the range of society who have used ivermectin, including doctors and nurses. So I don't think it's a big deal, even though it's more like on paper it's not there, but in practice people do use ivermectin without any issue. And I did bring up the issue of Dr. Gilberta St. Rose from St. Lucia, who is being unfairly treated by the authorities there for her use of ivermectin, when right throughout the Caribbean, and I must say throughout North America, the ivermectin is actually used without any penalty on the people using ivermectin. Okay, any other questions? Can just raise your hands or just go ahead and unmute yourself and ask a question or make a comment. We'll probably, oh yeah, Carol, I'm gonna ask you to unmute yourself. Go ahead, Carol. Go ahead, Carol. Carol, are you there? Unmute yourself and go ahead and ask a question. I have allowed people to unmute themselves, so you should be able to unmute yourself. Okay, I think Carol is temporarily distracted. Okay, right, so this meeting, yeah, go ahead, are you here?
Yes.
Carol? Okay.
Yes.
So, okay, all right. If there are no more questions or comments, we have Dr. Frinia from Grenada. Am I right? Frinia, do you have any comments or questions? Just share with us.
Dr. Hunter, yeah, I tried to stay on toward the end, but thank you so. I just want to say thank you so much. We do appreciate all the work you've done and continue to do, and the testimonials were really awesome tonight. So thank you again.
Thank you. Thanks for having us, and we will keep in touch.
Yes, thank you, Dr. Hunter.
Right. And let's see if I can ask comments from Mr. Facey. You have any comments as someone in the education field, but also someone who was in the hospital system? Mr. Howard Facey, you have any comments to add at this stage?
Good night, Dr. Hunter, and the
my friend from
yes,
Linstead.
Yes, Linstead. I must commend you for the great work you are doing in enlightening the people of early home-based treatment, and I think this will go a far way in helping the nation on a whole to minimize the impact of COVID. So congratulations again, and we will talk.
Thank you. Nice having you. Blessings. Keep well.
Thank you, sir.
Faithlin, let's hear from you. Faithlin Williams, my co-host.
Mute myself. Hi.
Lovely.
Good evening, everyone. I joined pretty late, but I listened to those testimonies and they are excellent. Really, really excellent. So Doc, I know you'll continue to keep up the good work. And I mean, what is coming from the participants here really speak volume. And as Doc would say, go forth and tell. It's the same tagline that I would use. Go forth and tell. I'm just happy that persons are really coming out and speaking. I listened to Yannick Brown folks. She was afraid in the initial stage to even mention that her husband had the COVID, or even to contact you. She was afraid. She didn't know that you would have, actually come on at that late point and even come on in the case of COVID. So, I mean, great things are being done. I too would have had my testimonies because persons have been calling and so on. We do have some success stories also.
Share with everyone. Tell us about the power of those.
Okay, great. All right. So just about 2 weeks ago, one of my colleagues called to say the entire family of 4 has contracted COVID. That's what they believe. So first of all, they call, because one of the things I said to them was, if you know of anybody who catches COVID, call me, because no one has to die. And so they were there for a couple of days. They weren't so sure about if it was COVID that they had. And when the wife called me and spoke with me, I said, that sounds like COVID. What I'll do, I'll come, bring you a couple of things. I took down the oximeter, the pulse oximeter. I took that down to her, the thermometer, and so on. I gave her those things and said, and told her that in the morning they should all go to the doctor and get tested. They really, to be honest with you, that night, the husband and the wife ended up in hospital. I encouraged them to steam also, and they really started the steaming. But when they ended up in hospital, all 4 family members went and they did the COVID test. And I'm here to tell you that the daughter who was showing the least symptom, she is the only one that came back with a positive result.
Wow.
Yes, the other 3 and the son, he had the most severe symptoms, and he came back negative. So when Dad called me and told me, I said to him, listen to me, you go and get a second opinion. And I shared with him, there are persons who would have had 3 and 4 tests and it still came back negative. So go and get a second opinion. And I'm sharing this to let persons know that, yes, you might get back a negative result, but just don't take it like that. Never let down your guard, because you don't know what can happen. So however, he went and they did the second test and it came back positive.
Wow.
And that was like, within 3 days, it came back positive. And by the Saturday evening, they went to the doctor. The doctor spent a good time with them, about 3 hours, giving him drip and giving them medication to boost their immune system. But by the Saturday night, when he reached home, the husband ended up in the hospital, chest problem. And by Sunday night, the wife ended up in the hospital. And they were very afraid. They didn't want the neighbors to know what was happening. They didn't want their church brethren to know. And that, I said, that is where the killer is. Don't be afraid to tell people, because you need the support. And the moment they began to talk, church members began to come in, some help to clean up, some cook and bring over soup and so on, sort of alleviate the pressure of them having to take care of themselves. But the long and short of it is that once at home, they continued steaming, and we monitored the husband at the hospital. I had somebody who would go in and check on him. Nurse and doctors would just check on him. And so family members, it's so important that even when the persons are in hospital, that you call and check in, because they will be left there and it's like they have nobody. If you don't call to say, doctor or nurse, this is what I'm hearing from my relative, go and check. Can you do a check to find out what's happening? But he came out of the hospital that's last Sunday evening, and they are doing much better. They are still steaming, because I encourage them to continue the steaming, and they are doing that, and they are so grateful. But the support is what made that big turnaround for them. They are still practicing the home remedies, and if they didn't get that early intervention, it could have turned out another way. But glory be to God, they are now survivors, and they can testify that early COVID treatment really helps, and not to mention the support that they get from persons who just chipped in. So my encouragement to all of you, don't be afraid to talk. That's what the devil wants. Silence you, and then when him silence you, you just, go into a stage where he takes you into depression and no help at all. And sooner or later, you end up where you don't want to end up.
Absolutely.
But it's a victory report that I'm reporting tonight. And there are others, but I just shared that one with you.
Thank you so much. This will help us to go a little further, a little longer, a little stronger. Thank you so much. It's making a difference. We know it's making a difference, but sometimes you need to hear it a little bit more to just help to continue. We're happy that our numbers are falling, and sad that the numbers are rising in the Northern Hemisphere. But perhaps in January, February next year, we'll see a resurgence. We'll have to wait and see. But we still have to make sure we learn from this experience, that we're not caught flat-footed, that we must be better enabled, be better empowered going forward to be better able to deal with COVID. So thank you, Caitlin. You're truly a champion. God bless, you're God sent, you're a sweetheart. And I know you had a busy night tonight, but you still found the time to share with us your time. So we're very grateful to you. And hopefully we'll have you back as a co-host proper at the next meeting.
Okay, I do hope so too.
Aim to have the next meeting towards the end of November. Are there any other questions or comments at this stage? Thank you, Caitlin. Any questions or comments at this stage? If not, we'll just move to have a wrap up. I think my colleagues, Dr. Heyman, are you still there with us? Roy? Andrea, you want to say something again or no? All right. I think everybody, that's it. I think we're gonna have an ending, a wrapping up now. So again, I'd like to thank everybody for coming out tonight. I'd like to thank everybody for sharing tonight. Elaine, is it that you want to say something, Elaine? All the way from Cayman?
Yes, Chris. Good night,
Hi,
everyone.
how's it in
I just wanted to say thank you so much for your dedication. And we're happy to be a part of your shows and to know that the people are really seeing the results. And I just hope and pray a lot of people or people here in the Cayman Islands will follow suit instead of running in fear and getting the vaccine. So thank you for all you do and all who gave testimonies. It was a big encouragement. And my friends appreciate it as well.
Thank you.
Good night, everyone. Love you, cuz.
Love you always. Thank you. Love to everyone. Blessings. Is Mr. Earl Whitmore, would you have a comment? Care to have a comment? I think I recognize you. Mr. Whitmore? No? Okay.
Yes. I just want to say how much I appreciate the many conferences that you have convened.
Thank you.
For those of us who have watched and listened, have benefited immensely. I had a very proud moment some weeks ago that I shared with you, and I would like to share now with the audience. I was at the pharmacy at the Heart Foundation of Jamaica, and your program was on, and the persons who were there, who were in line waiting to pay and then to collect their prescription, were watching very, very intently. And then there was a lady who was standing some distance from me, said, you know, and a doctor that saved my life, you know. And I looked at her, and then she caught my eyes. And I didn't say anything to her. And because I know you, and because I know your father,
yes,
who was a lecturer at Nakalra when I attended in 1967 to 1969.
Wow.
And it was a very proud moment for me to know that my lecturer's son was now helping Jamaica in such a dramatic and tremendous way. So I'm very proud of you, Dr. Hunter.
Thank you, Sir Whitmore. You know, the Lord knows best. I mean, it was supposed to be a nice reunion, but the Lord ultimately has the call. And you know, this is a wonderful opportunity to still reach people and to get to people. So perhaps we'll set up a little link that you can see your former lecturer and say hello to him. I'll try to arrange that for you. But thank you for your amazing comments. It certainly warms my heart and helps me to continue that journey a little bit more. And I want every doctor, not just in Jamaica, but right across the globe, to be empowered to feel that they can treat COVID early, and that every patient, every civil society can be empowered to know what to do early. And, you know, we hear from Faithlin, and we now know that Sir Earl, you are empowered in terms of what to do early, not just to stay home and quarantine and watch. But I am so humbled by your comments. I'll certainly convey that to my dear dad, to let him know of your feelings towards him, and I know your love and admiration, and for his other students as well. But I thank you tonight for contributing to this and making it such an amazing conference. Thank you.
You're welcome.
Okay. All right. So is there any other comment? I think it is up for now to wrap up. Thank you for coming. Thank you for sharing. Thank you for being a part of this conference, this series, this trilogy, this continued journey into the COVID conversation. We're happy tonight because our numbers are falling. So I'm going to bid you a good night, to be empowered to go forth and tell, and to share, like, and subscribe this program. And of course, I'm available for you, anything with COVID related. My day job is really a neurosurgeon to take out brain tumors and spinal problems. But right now, so long as there's somebody in need for COVID care, I'm fully available. But thanks again for coming. Thanks to Pastor Mary. Thanks to Mr. Andre Duncan. Thanks to Leroy Heyman. Thanks to Dr. Seymour Essor, both a dentist and a patient. Thanks to Michael James. Thanks to Whitney, who hosted us so well. Thanks to Lorna, hosting us from and live streaming us from Florida. She is an amazingly talented Jamaican who is doing amazingly well in Florida and hosting so many big brand name companies. Thank you all for coming. We will continue this process. We're a little late in advertising it. Next time we will promote it and to be a bit more forward so that we can have more people participating. But you all have a duty now to go forth and tell and to share. So thank you very much for coming. Do have a safe night, safe journey, and be well until we meet again the last Wednesday in November. God bless. Thank you.